Okay, this December 16th, 2020 meeting of the Oyster River Cooperative School Board will come to order. First action is the approval of the agenda. I have no changes. Could I have a motion to approve the agenda? Denise?
Yeah, I'll make that motion.
Moved by Denise. There's a second. Second by Yuzi. All in favor, raise your hands. 6 in favor, the student rep in favor. The agenda is approved. Public comment. We have 6 people who've registered with Todd Allen, so that means everybody has 3 minutes. When the light goes red, that means your 3 minutes is up. So come on up.
Hi there, my name is Erin Bobo Karen. I'm a 5th grade teacher at the middle school, but I'm here tonight to talk as a mom. I have 2 sons in the district, an 8th grader and a 10th grader. Each day at the dinner table, we ask them, how was your day? What did school look like today? What went well? And we consistently hear the same message. They talk about their live lessons online. They talk about the stories their teachers tell, the debates they have with their classmates, the demonstrations they watch, and the questions they're able to ask. They talk about specific interactions. They talk about they retell the jokes that their teachers told in class. There's a real connection there. My 8th grader today was talking about how nice it is just to see people's faces because the screen is there. You can see, we don't have to have our masks on. Throughout the day, I check on them between teaching my classes, and they look very engaged. They're talking. I can hear the teacher talking. They're writing away. They're doing their work. They're very engaged. We're lucky. Our sons' school is fairly easy for them. They are pretty organized. They get most of their work done. They get pretty good grades most of the time. But another observation we're making is that asynchronous learning is equaling disengagement and disconnection. Even though they're organized and they have their study areas, they are having trouble staying focused all day long without that live teacher and student connection. Our 10th grader, there has been an increase in the afternoons on Mondays and Tuesdays, more asynchronous time. He's losing interest, he's losing momentum. He doesn't have a reason to come into school. He's not having trouble with his classes. So he says, Mom, what would I do if I go in? I wonder, what would he do if I sent him in? So to him, it's time off. Asynchronous time is time off, and he still pulls off pretty decent grades. So I want you to know, if you choose an option that's increasing asynchronous time, you're supporting, you're sacrificing engagement. And I think that's what students need right now, is engagement. They need to connect with their friends and their teachers. And even though it's through a screen, it's real. There's still real connection there. And when the screen's off, no connection. So that's what I wanted to say about asynchronous learning.
I think your time is up, so.
May I say one more thing, or am I all done?
Quickly.
The concurrent learning. I want you to think carefully about what philosophy and pedagogy you want my son's teachers to follow. If I choose to send them to school and you are supporting concurrent learning, will they be sitting in a room and their teacher will be running around speaking to students on a laptop, fixing technology issues, or will they really be able to work with my sons?
Okay.
If I choose to keep them home, will they just be sitting back and watching while the kids in class are doing hands-on activities? I just want you to think through what that would really look like. It sounds nice, but I hope it will meet the needs of my sons.
Thank you.
Thank you.
Okay. Hi, I'm Olivia Gass. I'm a junior here at Oyster River High School. I'm here tonight because I listened into the school board meeting this morning with the Student Senate, and it prompted me to feel the need to come here and represent a good majority of some of my peers. I did a quick poll on through my Instagram, and the responses that I got were worth sharing, I thought. The question I had asked was, simple, was which do you prefer more, online learning or remote learning? In the poll, I ended up having 19 people vote that remote learning was what they thought best fit them, and they liked that better, and I had 62 people vote for in-person learning. I went through and looked and took off anyone who voted that was not from Oyster River, so this is all Oyster River students. That ended up being 77% of students voted for in-person, and 23% voted for remote. Here are a few of the highlighted responses I had asked. So I asked them, which do they prefer and why? And some of the ones that I thought were the most, were very impactful. So here are a few of them. I feel like I have better chances of getting the right help from my teachers when in person. The next one is, I like in person better because I can grasp the educational content easier when I see it in person. And then the next one that I thought was good was, right now I like remote better because I'm used to it, but I know that in person is much more better. This is a straight quote, so there's a few grammatical issues. Much more better because it is more in-depth in person. The next quote I had is, I like remote learning better because I don't like socializing. The next one I had was, because I learn better online. And then the last quote that I thought was really important was, in person, this is the quote itself, in person because it's more effective for teachers to communicate, and I need human interaction. Also, remote learning has ruined my habits, and I can't be productive like this. Out of the 26 responses that I received, these were the ones that I thought stood out the most and really covered what everybody else was talking about in their, in their responses. They all were basically like this, similar thing. So what I had to say about this was that I agree with a lot of these. I feel like remote learning has some good things, I guess, that you could say, but it also has a lot of negatives that really impact students as they learn. I know for me personally, I struggle staying not paying attention, but staying connected with the teacher and stuff. And it's really hard to do to stay connected with the teacher and the class that's going on when no one has cameras on and stuff like that. The other thing that I wanted to say was that, was that if we don't go back this year, then my only year fully in school would be my freshman year. And I really think that is not a good high school experience. And I really feel like that this decision should not be an all or nothing thing, and that there's steps that can be taken to help get more students in person and to better our learning overall. So
thank you.
Hello. My name is Saskia Huritz, and I have a freshman son and a senior daughter here. And my husband spoke at the last school meeting 2 weeks ago, and I'm going to kind of echo what he said, the incredible frustration I feel at there being no plan sent out to Oyster River families as to what the school is doing. My daughter is a senior, and she is very organized and self-motivated. She does very well. She's very sad at the thought of spending the rest of her senior year online. My son, who is a freshman, is having more trouble. I'm finding on the days that I'm not working and I'm home, he's sort of bouncing off the walls. He'll have a class that lasts maybe 15 minutes, and I see him, tinkering around the house. I said, why aren't you in class? Oh, my class finished. I said, are you supposed to be doing anything? Well, it's independent learning time. Well, I don't know about most 14-year-olds, but independent learning time to him means watching YouTube videos, playing video games. It's not independent learning. And it's just really a shame that, my coworkers, I'd say 95% of them have kids that are in some sort of hybrid. Not right now, because I know the cases are up and schools have pulled back, but I go into work and they say, oh, is your school back in? No, we're waiting. It's like kicking the can. It's been since August that we have had not a clear reason as to why we are not in school, and what are the criteria for getting back to school? Are there, Dr. Chan, the CDC, American Academy of Pediatrics, these kids need to be in school. There's just no other, I understand, if it's not now, come January, let's have a plan, because to think of the next 6 months that these kids will be in front of a laptop, it's just heartbreaking. And I'm really pleading with you. I know it's not, it's not easy to figure a lot of, logistics out, but if you can just really work together and try to come up with a plan, I think a lot of families would really appreciate it. And thank you for your time, and hope everyone has a nice holiday.
Thank you.
Mr. Newkirk, we've added 2 additional speakers, just so you know.
Okay, so that's 8 total?
Up to 9.
Okay.
Hi,
Oh,
I'm
sorry.
Brooke Keeler.
I'll have to call it at 7:30 because we have the doctors coming in. So at 7:30, I have to shift. But
I'll try to make it quick. Are you guys getting tired of me yet? I'm coming back every single time because I don't think it's your guys' job to protect us from ourselves. I'm not sure what your mindset is around. I think we all agree being in school is obviously the better choice. I know you guys all must agree with that. We obviously have a problem with COVID. I was here for the Barrington meeting, and I was listening to the superintendent, and I was a little disappointed with the board just because you seem to take more of a defensive posture. He said a lot of interesting things, and I would have expected you guys to maybe dig into it and ask him some questions. He talked about what kind of data they're using. We talked about community spread and whether or not that's a factor. So I know Michael Williams, I got to imagine, knows how to put a weighted spreadsheet together. We do it at my office all the time. I'd really like to see a weighted spreadsheet from each faction, so the board, the teachers union, and the administration, ranking where you think things fall in level of importance to get back into school. If you do that, it's a scientific way of doing it. You then have your launch plan that you guys were talking about. I'd love to see it. What's your launch plan? Who are you relying on for legitimate information, which I know is a difficult thing to do these days. I mean, the CDC was basically a puppet for the government for a while, so using their information may not be legit. But where are you getting your information? Have you talked to other school boards or the superintendent of Barrington and asked them what their best practices are? Please make it public. Please publish something that tells us what the launch plan is, what you're going to base it on. We realize things may change or shift. We just need a plan. We've been asking for it now for a long time. So I hope you can put the effort in, make it happen, use your local resources, find the best data, discuss what that is, and produce something. I know you guys want to get kids back in school and you're dealing with a difficult issue. And I'll just say this. So the vaccine is on its way. It's out. Frontline healthcare workers are getting it first. I think teachers are next in line and should be. I think they're the most valuable resource other than the people that are directly caring for people with COVID right now. So if all the teachers were vaccinated, could we go back to school? Just a thought. Thank you so much. Thanks for your efforts. Appreciate it.
thank you.
Good evening. My name is Chad Mishu. I'm a parent of a ninth grader from Barrington. And it wasn't my intention to get up here this evening to provide a counter argument to the first woman's presentation, but that's exactly what it is. I just want to give relay my son and some of his friends' experience with the asynchronous learning when they come in on that one afternoon a week. They come in on a Tuesday. It's made a huge difference, and I want to thank you for implementing that plan. But that goes, I mean, we need to do more of that. The turnaround that there's been in my son and his friends and their attitudes coming home from that situation where they come into the school for the hour and 3/4 in the afternoon, they do get to meet with their teachers. It's a positive impact. They get to get themselves organized. There's a huge social component to it. My son has come to school. He came home yesterday raving about all of the social interaction that he had with his peers, how much that meant to him. So it does make a big difference. And to go with my counter argument to the woman's first presentation, the synchronous time online, she says you can see everybody's face. It's awful hard to see everybody's face when you've got 18 blank screens. I walk by all the time. I'm home all the time with my son. I oversee what he deals with at school, and the screen is a bunch of black boxes. Nobody has their camera on. He probably is tired of me saying that, turn your camera on, buddy. Turn your camera on. You want to make a connection with your teachers. You want to know what they want. You want them to know what you look like. He's probably tired of me saying that. But I'm trying to have him keep his camera on, but you can't make a connection with your teacher and your peers with black screens. So that's all I have to say. Thank you for your time, and I appreciate the efforts you've had.
Thank you.
Greetings, everyone. My name is Matt Pappas. I'm a teacher here at the high school, social studies teacher. But I come here wearing 3 different hats. I'm a parent of 2 teenage daughters who are both remote learning at home, being a teacher here at the school, and I'm also a school board member in Rochester. But I'm here to give you sort of a teacher perspective of what's going on. And I do sympathize with all of you. I've been in your seats. I've made decisions like this before. It's not easy, but I thank you for stepping up to do it. But sadly, we cannot turn back the clock. It's well known that you are discussing the potential for a return to in-person learning for the high school. But I must tell you, and let me preface this by saying I am speaking for myself, not for any group or what have you. I'm just speaking for myself. But I must tell you that the time for in-person learning was in September and October, when COVID numbers were low, before flu season brought numbers to historic levels. That is what Rochester did. That's what Barrington did. And sadly, Oyster River did not do. But these schools are now pulling the plug on in-person learning, as you've seen. But we missed the boat, and it's considering going back against the tide of common sense. To send students back now with numbers growing as high as they are would be unconscionable. Please do not take or make any changes to what we already have. What we have, we're settling into a routine, just getting going, and it seems like it's going to change yet again. Turn on the news on any given day, you can see that our country, our state, and even our community here is in the midst of a pandemic of epic proportions, and it's getting worse. Anyone with a loved one inflicted with this virus knows very well that this disease is real, it is here, and it is in our schools. It's frightening to know that this virus is all around us and can strike any one of us at any time with devastating effects. I know my own nephew still hasn't fully recovered after months after his diagnosis. I often hear from people that children and teenagers somehow are immune to COVID-19, and that's simply not true. New Hampshire HHS numbers bear this out. And as of this morning, 2,454 children in New Hampshire have tested positive since March. All of these children, whether symptomatic or not, were contagious. The look of shock, fear, anger, and anxiety are regular occurrences in the school. Yesterday, 4 colleagues in my department were home quarantining because of a potential exposure. with someone with COVID. I narrowly escaped myself as one student stayed home yesterday who later told me was with somebody who tested positive. It's not a pleasant experience, nor is it to see a classroom cordoned off with yellow caution tape and orange cones with do not enter signs. Adding to the stress of students and staff alike is the fact that changes by this board have necessitated numerous changes to our schedule. We have 5 different schedules for each day of the week. No 2 days in our schedule are alike.
Matt, your time is up.
Okay, I'll just finish my last couple sentences. We all want to return to the classroom full of our students. And I hope you take politics out of this equation and listen to the professionals and say large groups are something we should not be doing. Thank you very much.
Thank you. Okay, we have about 9 minutes, so if you can keep your comments as brief as you can.
Hi there, I'm Michelle Dundor. I have 4 children in the district. I just want to tell you my experience. My son goes to St. Thomas, and I think they're doing an excellent job. They have had a few cases, but there's nothing been linked to the COVID connection in school. All of their cases have been out in the community. I think you'll find that science across the country. The forced remote learning is literally killing our children. My 2 middle school girls have now entered into a private school situation because they had become progressively despondent. Their education consisted of finally in their beds, in their pajamas, looking at a blank screen with 100 black little dots with no microphones on, no connection whatsoever. They've been to the pediatrician. The pediatrician was saying that they need to go see counseling because they're so depressed and despondent. They've been to the eye doctor. My child has one eye that's almost legally blind from staring at a screen for this long. This is not developmentally appropriate. The teachers know this. Yes, we are in a crisis, but it is a manageable crisis. The rights of the children supersede this, and what we're having here is we're having a battle of the wills. The teachers won't teach. The parents want their kids in school. Your guys' job is to represent the parents and the students. So I actually have a couple of call to actions. I've been the PTO co-chair for 4 years. I've raised myself, part of everyone else, part of the PTO. You know how dedicated these parents are. They do everything. $40,000. I'm going to ask everyone out there that's watching, please do not give up on this fight to do what's right for your kid. You can stop funding the PTO. The second call to action, you can actually write to the individuals in the school board who voted against this back in March or back in October. The 4 of them, you can ask for their resignations. Please do that. I also need another group of people to start a GoFundMe page so that we can get legal representation, because January 1, our kids will be going back. There will be a process. If these school board members will not resign, we will force them to resign. We will not be held captive anymore. The kids' health are at stake. Number 3, I know that there's teachers out there who believe the cause. I know that there's teachers out there who want what's best for the kids. So please do not stay silent. Message Jill Paparo, message me. Tell your principal that you are willing to go back to school. You are willing to wear a mask. You are willing to do what it takes to get these kids back in school. Please don't be silent anymore. Please do not hide underneath your union. You can come up against this. We have to fight for what's right for our children. Number 4, I would love for someone on this school board to make a motion tonight and vote on that teachers must be required to enter school buildings in their classroom and teach remotely from their classrooms until we can get these kids back in school. There's no reason while teachers can be at home in their pajamas and just teaching to blank screens. Please have them come into their classroom, teach remotely. That is happening all over the country as well. My sister is a teacher in Indiana, and she's willing to go to her classroom and teach her children remotely. Please,
Michelle?
do not give up the fight, people. Please. Thank you.
I think this will be the last speaker then.
It might be. I might be. Hi, my name is Justin Disco. I have a junior daughter here at the school, and I have a son that graduated a couple years ago. I'm also an educator. I teach high school. I teach at Spalding. To be honest, I think that the school board missed the boat. You guys should have gone back to school at the beginning of the year to make that connection with the students. I think it's imperative that teachers make that initial connection with students. I go through this every day. I go through the blank screens. I have one student out of 46 that will show their face. One out of 46 in my district where I teach. My wife teaches as well. She has 3 students out of her classes that will show their face. Our daughter basically just listens to teachers literally drone on. There's no teaching. There's no interaction. It's like watching a YouTube video. That's what they're doing. You might as well put the education on the YouTube. We bought a house in this district because we wanted to go to this district. We moved from the Exeter district to this district. And I'm ashamed to be in this district. And I'm an educator. And I moved to this district. This board is inactive. That's my opinion. This board is inactive. Make some decisions that benefit the kids. I have so many kids that are losing out on the MSTT, the multi-tiered systems of support. The teachers are the front line for those kids. This district is different than Rochester, but I imagine there's a good swath of kids that are not getting that help, that are not getting that frontline defense. That's what the teachers provide. We're there every day. Yes, we can teach in our classrooms. I can teach at home. I can teach in the classroom. But it's not the same. You guys, you have to have a plan to come back to school. We're doing it at MLK. Come up with a plan. Evaluate every 30 days. That's what we're doing. It works. It works. That's what I have to say.
Thank you.
Thank you.
So we have, I think, about 3 minutes until the physicians come on, so we could let's have the approval of the minutes. Denise?
I make a motion to approve the regular meeting minutes of December 2nd.
Moved by Denise. Is there a second?
I'll second.
Second by Michael. Any changes?
Yeah, I have. So on page 5, the third paragraph, which is my comment, I would like it to be worded to say, Denise expressed her frustration that the updated information from the Finance Committee was not sent out prior to the meeting, so there would be time to review it.
Okay. Other changes? All those in favor of approving the minutes with those changes, please raise your hand. 6 in favor, the student rep in favor. We can start with announcements, accommodations, and comments. We might be interrupted. From the district? No? From the board? Denise?
Yes, I want to thank Megan and the other members of the High School Student Senate for inviting us to participate in their meeting this morning. I found it extremely informational, and I got to say, I think that if these kids were running our country right now, we'd be in much better shape. The second thing I wanted to say is just to kind of correct or just explain something that I had said to a group of parents to the effect of that we need to let our kids know they're going to be okay. And what I meant by that was we need to give them hope. And I firmly believe that it's our job as adults to do that. And that doesn't mean that we minimize the impact that COVID is having. I recognize there's a huge impact. There are losses that need to be grieved. I completely get that. But I do believe that we need to reassure our kids that we have faith, that they can get through this, we can all get through this, and we will be with them every step of the way.
Thank you, Denise. Other comments? So we move to the unanimous consent agenda. I'll try to make sure there's a motion this time. Last time, I guess we had a vote without a motion. So could I have a motion to approve the unanimous consent agenda?
So I'll make the motion, but I'm going to read what's on the unanimous consent. So, motion to approve the list of policies for second read and adoption and deletion. A motion, second read adoption for policy GCQC, which is resignation and retirement, GCP, which is staff vacancies, GDR, work rules for staff, GCRD, tutoring for pay, and for deletion, GCKA, overnight program implementation, GCN slash AFC, which is evaluation of professional staff and teachers, GDPC slash GCPC, which is retirement, and finally, GCQB, publication of creation of educational material.
Okay, so you moved it. Was there a second?
I will second.
Second by Denise. Are we ready to vote? All in favor, raise your hand. 6 in favor, the student rep in favor. The unanimous consent agenda passes. Are we ready now?
Yep. So just want the audio going toward the participants this evening, for some reason our microphones aren't reaching their ears. So if the board has questions beyond the questions we submitted, I'll just have to repeat them into the microphone on this computer, and then they'll be able to hear you. Okay. So we should be able to hear them fine, hopefully.
Okay. And this will last no later than like 10 after 8. Let's see.
So, Josh, if you can bring people up on the screen. So I just want to do a brief introduction and thank the Dover people for being able to come in. The 3 people that I'm aware are coming in. We'll have them introduce themselves and their roles. But these 3 people have been working with the Dover school system from the beginning of the school year. They developed metrics that I put in your packet in terms of how they make a decision related to the Dover school system. And we're very pleased that they were willing to give us time to work with us. The questions that they've been given were submitted by the school board, and they've had them for a bit, so they should be ready to go. So I'm still waiting for an image, Josh, on 2 of them. Megan, would you like to introduce yourself? You've been so patient since you came in at 7 o'clock.
Can they hear us?
I don't know. Came in at 7 o'clock.
Sure. So I think what I have to do is turn off my ability to hear you so that you don't get an echo. Can you hear me okay now? Okay. Hi. Thanks for having me join. I am Megan Harvey. I actually came through Oyster River a couple decades ago. And my parents and family still live in Durham. And you're probably familiar with some of my family members. But I live in Western Massachusetts, and I have a PhD in epidemiology. In my normal epidemiology life, I study maternal and child health, but epidemiologists are trained in all areas of epidemiology, and so part of what my training and what I know how to do is interpret data surrounding infectious disease. And so I've been volunteering and jumping in and helping out with a couple of different districts in New Hampshire and also in Western Massachusetts, including my own home district in East Hampton, Massachusetts, to try to help make sense of the numbers that we're seeing in the data. And that's me. I'm happy to be here and answer any questions.
Great. Thank you so much. Scott, would you like to introduce yourself?
That's not looking good.
Scott, can you hear us? Scott, can you hear us? Let me do that.
Yeah, quite the echo, but I can hear you now.
Okay. Try to do this over here, away from the microphone.
Yeah, you've gone silent again.
Yeah. Could you introduce yourself?
Hi, I'm Scott Schuler. I'm the incident commander for the Stratford County and Seacoast Public Health Incident Management Team. We've been responding to the COVID-19 incident since March in the very early phases of this. And we have a team that runs across the greater Seacoast that delves into the response from things such as the alternate care site that was set up at UNH in the event that the hospitals had to surge. We work with our healthcare partners. We work with the vulnerable population to make sure all of the normal, everyday social services needs are met throughout the two regions. We also are responsible for all the vaccine distribution within the two regions with our state partners. And that's kind of, our goal is basically looking at anything that COVID-19 affects, whether it be directly or indirectly in relation to public health.
So I'm trying to stay away from our microphones. We submitted questions in advance, and we'd ask you two to jump right into them.
Okay. So you'll hear me a little bit, and you'll hear Dr. Harvey a little bit as each of us kind of move through our questions. And I think both of us are probably more used to just kind of taking the questions and answering them on the fly. So I'll read the question and then handle that as we did have the ability to prep a few notes as well. The American Academy of Pediatrics has recommended that schools should allow children to be physically present in school as much as possible because of major health, social, and educational risk to keep children at home. What evidence is there of an actual increase in youth mental health and social challenges during the pandemic? And this is a very valid question and a good question. One of the problems that I would say with any studies that exist, especially around mental health, is it's one snapshot in time. We know locally that there's an increase in new onset anxiety cases since the COVID-19 incident started. I don't think there's any study that we could understand or have that would give us a cue of what would that mean for long-term effects. Presently, we know from two studies outside the United States that suicide rates have gone down during the COVID-19 incident. But we also know that in the U.S., cardiac arrests linked to overdoses have increased. And a lot of times, overdoses and mental health certainly are all intertwined. In a meeting this morning, I specifically asked our medical examiner's office about COVID-19 suicide rates since COVID-19 started. And they don't have that data to share as of yet. After the first of the year, they're pretty good at giving that back to us. And, anecdotally, they feel like, okay, well, while there may be an increase, we also know that we were already having an increasing trend in our suicide rates in all age groups prior to COVID-19. So sometimes that correlation versus causation may not be overly evident for years after this. Additionally, the National Alliance on Mental Illness, some of their initial data inside the United States would also suggest that from a suicide rate perspective, those spikes have not increased as we would have feared. And I bring that back to the question of we very much agree children should be in school. However, because we know all the great benefits to that. However, through multiple other countries, it's becoming clearer that the way to a healthy school during the pandemic is through having low community spread. The next question was considering the restrictions and stress of in-school instruction. Are there solid data to show that kids are happier once they can go to school through a hybrid model? I've not seen any studies specific to this. There very well may be in the realm of education. I'm not an educator and won't dabble into that. But what I would say, since getting into this and working with different systems, it's very clear that if you've seen one hybrid model, you've only seen one hybrid model. You could have them even look quite similar. However, when you look at the experience of the user on the other end of that hybrid model, they may all feel very differently. And at the end of the day, that's going to change how that data looks when you look at one district to another. So I think until we see some really large-scale studies or studies that are specific to us here locally in your districts and in New Hampshire, that's going to be a very hard question to quantify.
So do you want to keep reading the questions and
I'll be
then
happy to.
answer? Okay.
From a health perspective, how should districts weigh COVID-19 risk versus mental health risk in their reopening strategy?
So I took on trying to succinctly answer this question, and there's really no good answer to this question. There's no official recommended way to rank these risks. What I always say is that we're picking between two really bad options. And so for you to feel like you don't have a good choice to make, you're not crazy. That's what's happening. We are picking between keeping kids out of school for their physical safety or putting kids into school and risking physical safety. And we don't know, the frustrating thing about public health is that by definition, we don't know when we've done too much. We're hoping to come out the other side of the pandemic feeling like maybe we did too much. That would be better than knowing for sure that you messed it up and that people got sick, right? So you're constantly creating this risk-benefit analysis and trying to figure out which is the greater side, and there's no one way to do that. So one of the things that I usually try to rely on is something, as a scientist, as often as possible, point back to an established theory. So according to some theories like Maslow's hierarchy of needs, if you consider like a triangle of kind of human needs, physical health is the base of that triangle. We can't have good mental health without physical health. Now, COVID-19 may not necessarily be a guaranteed risk to physical health. As Scott was just saying, it really depends on community transmission. So what that means, this is a long way of saying that there's probably some, with a margin of error, there's some number, some cutoff between when community transmission is too high for kids to safely be in school and when community transmission is low enough that it's safe and we should sort of switch the priorities. And talking about what that cutoff is and the science behind that cutoff is a little bit tricky. It depends who you ask. One of the things that's clear right now is that we're way above that in pretty much every location.
Thank you.
So all of these questions were broken down into categories, so that kind of concludes the mental health category. If you're okay, I would prefer to continue on, and if there are questions for us.
Go on.
We've lost his voice.
We both kind of made some notes into this, and Megan excitedly said, yes, the fall, and I agree, but I can put that with a caveat of if all goes well. Everything just pretty much has to go perfectly. I would expect that you'll see teachers, they're sitting at tier 2 vaccination within the state plan. I think I would be stunned if we can get shots in arms into tier 2 prior to the beginning of March. But if all goes well, hopefully we can start vaccinating that population in March. And that will kind of lay the groundwork for how fast we move through the rest of the population. When can we expect our teachers and staff to be able to access the vaccine? Kind of the same question, very similar. And again, I don't think the teachers will receive vaccinations prior to March. You will have a few staff members, perhaps, who fit into what's being referred to as Tier 1B. Perhaps they have some underlying health conditions that qualify them for that, and they would fall into that category. And likewise, Tier 1A, your school nurses will fall into. What is the process and anticipated timelines for making these vaccines available for children? Is fall a reasonable hope? And, we both have been following this very closely, very excitedly. What you'll find is that there are a few trials now that have children ages 12 to 18 involved in it. And I think based on the emergency use authorization and how fast that process is being moved, and by fast, we're referring to a lot of different things that are normally done over a long period of time, kind of all being done at once. That's one way to kind of look at this. It's not that any steps were removed. It's not a process was skipped. It just means that there was enough effort at one time to be able to move all the components forward that normally would be done in different successions. So with that said, I think it's very reasonable as long as the vaccines prove to be safe and effective in the population. Don't be surprised if we see any of them in tier 3 have to halt. That's normal. It happened with some of the others that we're seeing come to fruition now. But as far as under 12, I'm not seeing anything on that necessarily out there on the horizon. The next question. In the months when an adult vaccine is available but a youth vaccine is not, how should we think about the increased safety of our schools? An example, could we increase student density?
All right. So I just want to reiterate the point that Scott made about the safety of the vaccine. There's a lot of discussion about, are these vaccines safe? How do we possibly create vaccines so quickly? Have safety steps been skipped? And I think the missing piece from all this is that these mRNA vaccines have been in production for decades that we've been working on them. And when you have a virus that's so common, you're able to complete your trials much faster than if you're working on, I think one of the examples that I read was like SARS Classic back in 2001. They're still working on a vaccine for that, but there's just not a lot of people who are getting that. So the trials take a really long time. We're able to move quickly through these trials because people are getting COVID-19 rather quickly. So what happens if we have basically all of the adults and perhaps older children vaccinated but not the youngest children? Essentially the answer that everyone is giving at this point is that because we don't know whether or not it just prevents symptoms or if it prevents transmission entirely, we have to keep all of our normal mitigation measures in place until we have universal vaccination or until we've reached herd immunity, which means a large enough percentage of the population is vaccinated or is immune in order to prevent spread through vulnerable populations that can't get vaccinated. So things like universal masking, staying 6 feet apart, and limiting the time in enclosed spaces, particularly with an eye to good ventilation, all of those things are going to need to continue until we have that herd immunity and universal vaccination.
The next question being, what would be the process, if any, for mandating that teachers and staff get vaccinated? If mandating is legal, is it a state or district decision? What issues, if any, should we anticipate towards ensuring our full school community is vaccinated? So I will give you basically, in quotes, what our Immunization Bureau staff gave us, which is, it is our interpretation that under an emergency use authorization, vaccines cannot be mandated. Now, I would like to say that was 2 state staff members who are high up when it comes to the Immunization Bureau and our vaccination efforts. And they were very clear to say it is their interpretation of the rule. And so I say that to say that if something happens in the future, that comes out to somebody else with a different interpretation. That's certainly not possible, but they felt very confident enough to be able to say that at that point in time. So that kind of moves us out of the vaccination category and into modes of transportation. The first question being, early in the year, it was thought that young children are less vulnerable to COVID-19 and less likely to spread it than older adults. Is that still the accepted view of professionals? what did we know about the children's susceptibility to COVID-19 and their contagiousness to others? Does this vary by age? We kind of, I think, melded two questions together there. So let Megan take that.
I did. I pushed two questions together because the same answer applies to both. This is the million-dollar question. This is the question about, can we open schools for in-person learning and at what density? And so I'm going to break it apart into a couple of pieces of information that we do or do not know, and you'll see what I mean as we go. So the first thing is that we have really good evidence at this point that kids who are under 18, when they get infected with the virus being SARS-CoV-2, that's the name of the actual virus itself, they are much less likely to get sick with COVID-19. COVID-19 is the name of the disease that people get when they start to show symptoms. So if they get infected with this virus, it enters their body and starts replicating, they are very likely going to have an asymptomatic infection, so they'll never even know that they were sick, or a very mild case of COVID-19, very mild symptoms. What that means, right, that's like the long version. The short version is that they don't get that sick. Kids under 18 don't get that sick. That's good news. It doesn't mean you could just have everyone come into a school building because there are still teachers and staff in that school building. And we don't know if the children are actually getting infected at a lower rate. So if everyone in the school building is coming in, all the kids are coming in, and they're getting infected, and they're able to transmit that to other people, but they just don't know they're sick, that's actually like the worst case scenario. That silent spread of the disease. And unfortunately, we just don't collect the data in the US to determine if this is happening or not. You'll hear a lot of people talking about their opinions about whether this does or does not happen in schools. But what I always say is that anyone who tells you that they know the answer to this really can't know that answer because we don't collect the data that would actually answer the question. Epidemiologists love data and data collection. And the proper way to answer this question would be to have widespread or universal frequent surveillance testing. So test everybody, people with symptoms, people without symptoms, test them weekly or bi-weekly, and then we would really know where cases have come from. We don't do that. Our best attempt to kind of cover that area is with contact tracing. And at this point, our contact tracers are totally tapped out and unable to do that. No fault of their own, because the caseload is so high. Contact tracing is a really nice method when you have a couple of cases to track where they came from. When you have widespread transmission, it's really hard to track where they came from. All of that to say, we don't know. We don't know when there's a case in the community and an adult. We don't know necessarily whether or not there was just before them or 2 steps back in the chain, a silent spread or an asymptomatic spread that happened among children, perhaps in a school. That being said, there is a very recent preprint press release of a study that just came out of Iceland where they did, this is the first instance we've seen of someone actually collecting this data. It has not come out into peer-reviewed research yet, so I'm very cautious in saying this. This is still waiting to be determined. But if this data is correct, it sort of goes along with what we are starting to feel might be the case among professionals in the US, which is that kids under 10 do seem to get infected and transmit about half as much as adults. Kids over 10 seem to be not significantly different than adults. So that might indicate to us that we can treat elementary students slightly different than we treat middle and high school students. But it's too soon to bank on that and make policies on that, but it's something to keep our eye on. I think the main conclusion that comes from all of this is that, while we don't know the answer to this, we have a lot of anecdotal evidence about what community spread looks like, and I know there's, all sorts of families in the community and teachers in the community who are saying, that district is open, and this district is open, and that one's been closed, and they don't have spread, and it's just really hard to connect those dots in a way that is conclusive. What it seems to, at minimum.
No.
Oh, no. Oh, wait, no, wait, stop.
Yeah, we want to hear, we can't.
Ask her to repeat that.
Yeah. Can we do a chat?
Uh-oh, for how long?
About
a few seconds here.
That was my most brilliant work.
She said, what we do know is.
After the study, the non-peer reviewed study.
I don't think she can hear.
So start back up after the non-peer reviewed study, I believe. Am I hearing correctly?
Okay, I'll try to wrap it up. I think I just solved the crisis and now no one's recording it. The study from Iceland's preprint indicates that children under 10 are probably getting infected and transmitting about half as often as adults. That tells us that perhaps elementary students can be treated a little bit differently than middle and high school students, but it's too early to say. That's something to keep our eye on. But I mention it because it's our first actual study that's attempting to answer this question in a way that would actually provide evidence for that question. The last point that I wanted to make that I was rambling on about is that at bare minimum, what we know at this point is that transmission within a school building will at least reflect the community outside of it. So when there's a community with high transmission rates, we're going to see cases in the school among teachers, staff, and students. And so that's sort of where you start making that cutoff decision about balancing risks and benefits of in-person learning versus when that risk to health is too high. And I'll go ahead, Scott, and read the next one. The next question, is about if schools are spreader sites when they follow protocol. How do we track asymptomatic spread if there's no testing? How do we know that schools aren't contributing to community spread? And then there's sort of, we know that there's schools that have been offering full-time instruction that have had cases in it.
Uh-oh.
That's like the good stuff.
Yep, every time.
We don't. Nah.
He's like,
Those who don't know, that's Stephanie Ward's daughter.
Oh. It's cool.
Can you hear me now?
Yeah.
I can hear you. I don't think I can hear. There we go. Great.
Hear me okay?
Yeah.
Okay. So I was just sort of summarizing, this was a question about if schools are spreader site and how would we possibly know the answer to that if we don't have widespread testing, and then there's sort of a reference to other schools nearby who have had cases. And my response is that your instincts are right on in asking the question. We don't know the answer about asymptomatic or silent spread because we don't have widespread testing. The best answer that we have at this point is that schools are at minimum reflecting community transmission, and that probably elementary school is a different beast than middle and high school, but we don't know much more than that. And you see cases in other schools because transmission definitely happens there.
So that moves us into the testing and contact tracing section of the questions. The first one being, what changes in testing do you foresee in the months after the new year? Candidly, I hope the FDA approves more over-the-counter tests and at a very low cost. The first one was authorized yesterday, and that runs around $30. I believe there was another one that was released and authorized today that's very consistent with the Abbott Binex cards that you've probably heard about potentially coming to the schools. A home version of that exists, and it's a little different where you actually have to log in and they kind of guide you through doing the test. But one of the advantages to that is it also reports it back to the states for tracking, which the other home test won't do. But either way, the more tests that we can get in homes that do not require a physician's prescription and are low cost, are definitely probably going to be one of the best testing methods that we can have long term to help us, and they seem to be on the very near horizon to do that.
There we go. Technology.
I think you need to.
You want me to wrap it up?
Why don't you, see if,
We'll have, what are some of the other ones? Might be we might want him to jump to some of the other questions possibly.
can you talk to, can we?
Alex can transmit our thoughts to them. Alex can hear us, so if anybody had a question, we can ask Alex, and Alex will transmit it to them.
Could we maybe look through, see if there are like 3 more questions or 4 more questions?
I think maybe number 17, I'm kind of looking at them quickly.
I feel like they're important, and maybe it's turning off video. Are there other technology solutions we could try?
We can't figure out why it's doing that, you see. Alex and Josh have been trying to
So
figure it out.
you should tell Scott that we're not hearing him, right?
Right. Alex, can you let Scott know that we're not hearing him?
Yes, I don't think they can hear me.
No.
Oh, you can hear me now. Okay, great. Okay, so I relayed most of that to Scott. So,
Alex.
So you guys can go from here.
Alex.
Okay.
Alex.
So this brought us down to a question of, do you recommend different levels of in-person, hybrid, remote based on the ability to cohort or contact trace, or based on the size of cohorts? For example, would you recommend different models or precautions for high schools where there are more students and mixed staff than middle or elementary schools where the groups interacting can be kept small even within the school?
Okay, so I will try to hit a couple of highlights here, and I'll try to be less wordy because I can talk for a while with these things. Essentially, no, I don't recommend different sets of sessions. You probably, in theory, could take fewer precautions with elementary students, but it doesn't make sense to relax precautions just because we think they maybe get less sick. There's so much we don't know about the virus that it makes sense to, follow universal masking with outside mask breaks and eating outside, 6 feet of distance at all times, and limited time in an enclosed space with a focus on good ventilation. And I think the other things sort of in this area were about what the heck is that rubric that I made, and is that reliable? And I'll just say that my only point that I want to make about that is it's a visual interpretation of data that I created. None of the data is created by me. Just putting it into a visual format. Am I off again?
No, she's on.
Okay, now you're back.
Okay, I was just saying that rubric that I created, questions about sort of like how useful and credible is that? It's just a visual representation of publicly available data. It's not data that I have run or I have collected or anything to do with me. I'm just a person who is taking that data and giving a visual interpretation of it. So if you ask me, I think it's quite useful and credible, but maybe Scott can chime in about how useful and credible it is. I think other things that you asked in this section are about if you should expand in-person learning at this point in a surge. I think the widespread public health response at this point would be absolutely not. That's a very unpopular opinion, I realize that, and it's such a bummer. I have 3 children who are at school age, and they are also virtually learning, and it's a real bummer, but that's my best answer to that. Let's go, I'll pass it back to you now.
And we're gone. Alex, we're not hearing again.
Hello, testing 1, 2. Yeah, I understand. I don't think you can hear me. 1, 2, 2. Testing 1, 2. Okay, there you go, Scott.
It's the same question we get asked in other places and in Dover all the time, which is, what's that one critical point of when we can be open, when we can have kids in, when we need to be remote? There's not one. There's not one single measurement that can tell you that. It's really looking at a number of different data points and figuring out which ones apply best to the situation on the ground and making a decision off of those.
Okay, I will try to address these last couple of questions here. let's see, how did we develop the safety protocols in Dover? We used peer-reviewed data. I always fall back on peer-reviewed data because I'm a scientist and that's where I've learned to gather evidence from. So universal masking and avoiding any time that we have unmasked mouths or faces or noses in a school building is the goal. So things like half days are preferable to full days because you don't have to take your mask off and eat if you're there for a half a day. The 6-foot distance, I know there's been some debate back and forth about if it has to be 6 feet or if it's 3 feet and where the heck did this come from. And this comes from a series of studies about the size of droplets that come out of mouths and noses and how quickly they fall to the floor. So all of this is based on fairly well-reviewed science that tells us, yeah, if you're within 6 feet of somebody when they are talking, you know, we can't see the particles with our eyes, but spit is flying everywhere and these little viral particles, but they'll fall to the floor within 6 feet. So 3 feet is not a great range to be in. A lot of the particles will still land all over your body. 6 feet is much better. However, that doesn't address the fact that this is an airborne virus, and we know that at this point, which means that we worry about being too close to somebody, but we also have to worry about being in an enclosed space for a long period of time with the viral particles kind of floating around. I always give the example of, if you think about what smoke does at the top of a room, that's what the virus particles are doing. It takes a really long time, if there's not good ventilation, for them to leave the room. And they hover there and they can infect you from far away. So those are sort of the 3 things that all the protocols are set on. So yes, I would recommend half days. We talk about 4 to 6 air exchanges an hour in a room, which is you know, hard to actually measure when you walk into the room. You can't be like, this seems like 5 air exchanges per hour. You know, things like open windows, open doors, and a fan to move fresh air into the room, that's always really reassuring. If either standalone HEPA filters or air purifiers, that's always a bonus. But unless you go into like lots of research and get an outside consulting company to come in, it's really hard to say for sure, like this is a 4 air exchange per hour room. All we know is better ventilation, better situation. So aim for as high a ventilation as you can get. Scott, anything that you would add, because I'm trying to like speed through these last ones?
Yeah, you know, I would just probably go back to, you know, really emphasizing, and we speak about this all the time, and candidly, we lean a little bit more forward on this issue than I think the state does at times. But, you know, having a mask on inside, and so we should also, all of a sudden, when you start talking about indoor dining, you have to pull your mask off to have indoor dining. Doesn't matter whether you're in the cafeteria, the classroom, in a restaurant. And that is definitely a weak point because it is now we have individuals who are unmasked, and regardless of the 6-foot rule or not, because this can be aerosolized, is airborne, that allows for movement of those particles through the classroom, depending on your ventilation and your airflow, and without being able to control that, it's just a tough risk. And it's one of the best ways we can mitigate community spread is saying, you know, reduce the amount of times that you're going indoors, and definitely don't be indoors outside of your household without a mask on.
Alex, can you express our appreciation on behalf of the school board? We know this was a bit of an obstacle related to the sound, but this was really great. I'm so glad the school board submitted their questions in advance because it made it, even though we weren't interactive, they were our questions.
We can't hear you now.
Yeah, sorry.
We couldn't hear you.
I was, so I'm relaying the gratitude of the superintendent and the school board. They apologized for the sound issues, and very glad that they submitted all the questions in advance so you could address them. And thank you very much, and thanks again.
Okay. So just in terms of closing this, the work that Dr. Harvey did is put in your packet, and this is the data that Dover has been using. It's the peer review data and how they make decisions. And so I thought this would be a good piece to share with the community when we put out our next newsletter related to where we are as a school system.
Great. So, Dr. Morse, I don't know if you have comments or parts of your report before the 9th grade report?
I do, thank you, Tom. So we are at that point where we're interacting with mini closures. We've done them pretty much every single day for the last 2 weeks. And what I'm going to ask is that we go to remote learning on Monday and Tuesday of next week, and that we continue in remote learning into the first 2 weeks of January, and then come back in the hybrid model and the remote MTSS model on January 11th. That date is, so my logic on this is families really did a pretty good job of restraining themselves in terms of travel and Thanksgiving. And that was hard, we saw people really put an effort in. But Christmas is a whole different holiday for families, and it's really asking probably so much of people not to touch base with their families if they have families in New York or, outside of New England. And if we open the 11th and people travel on the 25th to be with family, it gives us that 14-day quarantine period. We would still teach remotely on, on those first 2 weeks, and we would still teach remotely on Monday and Tuesday. But I really think at this point, because of the number of incidents we've been having, including as I was ending the workday today related to our athletic program, that it just makes sense at this point to go remote for those 2 days and then the first 2 weeks of January to let everybody kind of collect themselves and hopefully get through that quarantine period and be able to start up fresh in January with hopefully fewer incidents than we've been dealing with really since Halloween. So Halloween, Thanksgiving, and now Christmas on top of us. It's really been an incredibly busy time in terms of informing families, that we need to go remote in a particular class, most recently, a half day at the kindergarten program in Massway, and then this afternoon with our underclassmen basketball team. So this has been constant, and I've been continuously informing the board every time an incident's happened and the number of people who are impacted. Check tonight, and Suzanne may have better numbers when she speaks, but we have 22 staff that are impacted at the high school and 16 staff at the Massway School. And yesterday, we had one staff member at the middle school, and we were all in shock. Today, it's 7. So that's how quickly things are turning around. And I just think that this would be the most prudent course for the immediate future to go remote on next week and the first 2 weeks in January. And I'm glad to answer any board's questions related to it.
Would this also, I'm assuming it would also apply to all district activities, meaning clubs, athletics, et cetera, or is that something different and separate?
I would truly, Dan, I would take a break completely for that time period. I mean, we're already seeing the impact. This is the third athletic program that's been impacted in a week. So I think everybody just needs to take a break for this holiday period and then come back.
Just to confirm, it's a single week of school that would be remote in January, right? It would be the 4th through the 8th?
Right.
And then, so it's just 1 week?
Yeah, thank you for that.
Other comments? Other parts of your report?
Yep, I just wanted to give people a chance to react. I didn't want to jump too quickly.
I think it makes sense. I think we're seeing, as you're saying, the numbers are increasing dramatically. Part of me thinks that we should go remote on Friday as well, but I think that might be too quick for families. I think Monday and Tuesday makes a lot of sense. Thank you for thinking of that.
Yeah, you're welcome. I think that really is really it. I already talked about the Dover report and in terms of the metrics they're using, and that was the other piece I was going to put out there. And just how much I appreciate the Dover people coming in and sharing tonight. That was really, I think, very, very helpful. A little frustrating, but very helpful. That's it, Tom.
Okay, Suzanne?
So as Suzanne goes up, I just want to share with the board as a whole, what I asked Suzanne and Jay to do tonight is create an executive summary of their report. The goal of the executive summary is not to go through slide by slide by slide of both of their reports, but to do an overview, and then as the board has questions, Jay and Suzanne can actually open their PowerPoint and put that particular slide up and answer whatever the questions the board has. Suzanne was asked to give a report on the 9th grade, and of course Jay was asked to do an update on option 2. So Suzanne?
Sure. Just let me get the PowerPoint up and running. Okay. Do you want me to project it, or do you want me to wait until?
I think you should put it up, and then as you're talking, they can see it, Suzanne.
Okay. I'm not going to speak to each individual slide. Josh, I don't know. Oh, never mind. Thank you. Good evening. I'd like to first begin by bringing your attention to 2 letters that are in the backup. One of these letters is in regards to our continued accreditation by the New England Association of Schools and Colleges, and the second letter is from our high school counseling department regarding their recent submission for RAMP certification. The NEASC letter that you see highlighted areas that the high school has made great strides in for the past few years, and we're really proud of this work. This work includes the staff's regular engagement and collective work on curriculum instruction and assessment practices, and I hope you have a moment to read that letter. The counseling department also included a letter, and in the letter you will see that they've been working for the past 7 years on fully implementing a comprehensive counseling program at the high school. This application is a RAMP application, which is a recognized ASCA model program, and ASCA stands for the American School Counselor Association. This application for RAMP certification is a major recognition, and one that I truly feel that our counseling department deserves, and I do hope that they do acquire that accreditation and that certification. You've asked me to present this evening about the 9th grade. And in the backup, you'll find ample information about the 9th grade. What I'm going to do is I'm going to simply summarize for you the information that you found in the backup. High school faculty were asked what they're currently observing as academic and social emotional challenges for the 9th grade. The faculty identified that the 9th grade was challenged with motivation and executive functioning, as well as communication and self-advocacy. The students were also surveyed earlier this year. 176 freshmen out of the 210 responded to the survey. 13% of them stated that they were not motivated, and 60% of them stated that felt that their motivation was neutral. One might ask if I'm surprised by these challenges and the reactions of students about their motivation, and I would reply that I am not. I've been engaged in the field of education for over 20 years, and 9th graders traditionally struggle with executive functioning skills. I would also expect this in a time of a global crisis and a pandemic. We're living in a time that's unprecedented, and research and reality are evident in these results. During a time of trauma and crisis, memory, motivation, and task completion are all dramatically impacted, and that is what we are seeing with our freshmen. Kids are especially vulnerable to this, as unlike all of us, Adults, their brains are not fully developed, and they do not have full capacity to self-regulate. Having said that, as we compiled the data that was collected by students and faculty, I am thoroughly impressed by our faculty and our students. High school faculty were asked what they were currently observing as academic and social emotional strengths for our 9th grade. And the faculty identified that the 9th grade strengths were areas of attendance, seeking help, resilience, adaptability, and kindness. These things are so vital in the development of a child and anybody, and are not measured on a test or in a paper. These are vital lifelong skills that are so important for us, and we highlight that in our vision of a graduate. Faculty were also asked about the ways in which they are adapting to meet the needs of our students. I am continually impressed by the ways in which our faculty have continued to adapt over these few months, actually many months. They have identified following areas which they have adapted to meet the needs of the students. The ways the faculty have adapted to meet these changing needs of our students: they've increased the amount of time that they're spending with students one-on-one. They're refining their curriculum, content, and pace. They're increasing parent communication and meeting with parents regularly. They're making adjustments with assignments, and they're having flexible due dates for kids that are in need of that. They are also continuing to make referrals to counselors. These adjustments have resulted in consistent grade comparisons for the past 4 years. And that is also in the slides, you'll see the grade comparison. If teachers were not adjusting accordingly and appropriately, you would see a large number of students failing than in previous years, and this is not happening. Our faculty and our staff are working extremely hard in responding to the needs of our students. They are working hard to ensure that all students are getting what they need. I've also been asked to discuss the next steps for the high school, and we are discussing this, as you all know, when New Hampshire has a very high rate of COVID. When I speak about the next steps, I'm not speaking about the timing, I'm speaking about the model. As I've presented to the school board since August, there are models and progression. The next progression would be a 50% model. I'm working on a new 50% model that respects learners, both in person and remote, as well as supporting the faculty with the new demands that a new model would impose. It's important to remember that any 50% model will result in the loss of contact time with teachers and therefore instructional time. If the school board would like to see more students in the building under a different model than what we currently have, some form of the 50% model would be the next step. And if you decide to pursue this, what I would ask of you is to make the decision early enough so that I have the appropriate time to ensure that the shift is done with the attention and the detail that it deserves. So at this time, I'm happy to answer any questions that you may have about the PowerPoint and the model.
So after the Barrington meeting, I kind of tried to distill down my thoughts because everyone's asking for a plan. So I think the most important thing is having a criteria to figure out which plan you're going to actually pick. And so I wrote down a couple of things. First of all, I'd really like to thank this was the first one I asked for, which is, I think Barrington said that, and that's, what are the gateway for the criteria to be enacted? So you can talk about a million different models, but unless you have this chart, you can't make a decision whether to actually launch or pick the chart. So what criteria are we going by in this three-pronged thing that actually allows us to move to the next phase? So that was the first thing. The second, really, as we've gone through all these models, it's really hard, and I know everyone thinks that a school board can make all these decisions, but I think really relying on our staff and administration to really tell us what is the best model. So if we're looking at phase 3 and we're going to move to that, if we've met the criteria that allows it to occur, what's the best model in the opinion of the staff and faculty that we move to? What is phase 3? And then what's the justification? Why do you think that's the best model? The next thing is what everybody's going to ask us, and I'm sure we'll be lectured on, is what are the limitations of the model? So we've heard already about the asynchronous learning as a problem. I know transportation is frighteningly scary. There's probably other things on the list, but what are the limitations and how can we address those limitations? And then I know it always comes back to this, especially with me, but budget. What about money? Is there anything that we need to provide? And if we need to provide it, then it allows, I'm going to make a strong suggestion here, just throwing that out there. I know the charge on the Finance Committee is really to work on the 21-22 budget, but if you allow us to sit and work on this current budget, where we can work on details of where money would come from. And so I think what I'm really looking for is something that answers all 4 of those questions. And so when we come back to us, and especially with a time frame, and I hate to be Scroogey, my family would probably say it, but if by the first meeting of January, we could say, you come back and say, this is what we think is the best model, we've answered these 4 questions, and that will provide the board the opportunity, it gives us enough to work with that we can say, yes, we actually want to move ahead with this. It also gives the community a clear vision of, they've asked for a plan, that's a plan. It has the parameters through it, so it takes the guessing out of it. We know that once we've hit the criteria in terms of transmission and all that, that it allows the plan to occur and that we can put it forward. So that's my 2 cents.
Al, could I ask you to repeat the 4 questions again, just to make sure that I have all, I wrote them down quickly, but I don't know if I have them clearly.
So the first one is the criteria. What is the public health criteria for allowing us to actually do the model? So that's number 1. Number 2 is what, in the opinion of the administration and the fact, what is the best model, and justify it. Why do you think that's the best model? Number 3 is the limitations. What are the problems with the model? And I know they're all ugly, so let's go through them. Again, we'll try to, once we know what the limitations are of the model, we can begin to talk about how we can address some of the limitations. And then, of course, the last one is money. What does it cost?
Could I ask a clarifying question of you?
I hope I can clarify, but yeah, sure.
Okay. So when you ask for what the next best model is, I would like to ask you what your goal is for me creating that model. Again, I'm trying to figure out how do we move, so you've done it a phase system, and the next one is specifically phase 3, which is a pretty significant increase. So what is the best phase 3 model under those criteria I just told you? And then, when we hit this mark, when could we do it?
Yuzi?
Thank you for the presentation, and I think, Al, your specification of these 4 criteria makes sense. For the public health, I wonder, one approach would be just to use Dover's as something that we keep an eye on, and also recognize that staff availability is in some ways a proxy for all of this. We want to be able to open and, not, to Denise's point, not be opening and closing all the time. And I love the idea of a January 6th or, 13th if administration needs a little bit more time to insert a workshop, but in those first 2 weeks of January to have a presentation of, of the least bad model. My concern is that the 50-50 model, we discussed it, right, in November, and it had too many limitations. The asynchronous trade-off was too high, and so I wonder what other sort of creative, back to the drawing board, modeling the administration can do, reaching out to whatever resources you need to, to have like in-person options, but also the limited, try to really limit the asynchronous piece. And
when you speak of in-person, are you talking about we have in-person options right now? Are you speaking of in-person instruction, so kids would go to their teacher and be directly instructed by them?
Yes, so in person for core classes.
Okay.
I think that we recognize there's going to be a remote trade-off. But it also, we have to respect and care for the families that want or need to stay fully remote, recognizing that it won't be as synchronous as it is. And I think we do need the flexibility we need to consider the switching costs of when an individual student, when a classroom, or when the entire school goes to, quarantines or comes back. So to me, and then, there's teacher load, how many modes they're juggling at once. But to me, the main criteria are, between a half a day to 2 days a week in person for core classes, for those who choose hybrid, to limit the asynchronous time in creative ways, and to limit the switching costs.
Megan?
Oh, yeah, sorry. I just have a general question. It's not specifically for you, but anyone can answer this. So for the criteria, looking at what Dover, is it the board's responsibility or administration's responsibility to adopt or define what our criteria is? Because I agree with many who spoke out that, maybe publishing a definite list of criteria for how we will be phasing back in, just, what metrics we need to meet in order to phase back in, whatever model that may be. But I'm not entirely certain if that is up to the board to decide and publish that list of criteria, or if it's up to administration, what body is really behind that.
If I could, Megan, I think UC said it best. The Dover has done this. They've done it through medical professionals, and we heard from them tonight. So what Dover does is every single week they apply this. Every single week they apply this criteria against where they are as a school system. And so I have a governance committee related to COVID, and we have complementary building level groups. And so what I would do administratively is every week we review this in relation to where we stand as a school system. I wouldn't reinvent, I wouldn't add. This is done by medical professionals, so this is the thing that I would turn to, because this is way beyond my skill set to develop better criteria. I think this is as good as it can get.
Yeah, of course. I completely agree. And I think that making this public, I don't know if it already is. I'm not sure of anything.
Yeah,
but,
what I plan to do over the holiday weekend, once we have definitive guidance from the board, is try to bring the community up to speed on where we are. In terms of talking with Suzanne in relation to the January 6th meeting, going back to that issue. We'll be ready to put a plan in front of the board. The criteria that Al laid out are very practical criteria. They're not esoteric. We can answer all of those. In fact, when Jay presents, you'll find that he used very similar criteria that Al just articulated tonight to run through his model. So it's very doable.
Yeah.
Denise?
So I appreciate, obviously, wanting the asynchronous, obviously, it is an issue. But I'm also concerned about requesting more plans, because I don't think we're going to get around that. A teacher can only be either teaching in class or teaching remote at the same time. And, we could tweak this. We could say, okay, half days instead of the whole days, but it's a trade-off, and there's just no getting around that unless we bring all the kids in, which obviously we cannot do. So while I appreciate, wanting to say, is there a way that we can do this where we don't have as much asynchronous time, I just don't think it's there, it exists. So, and as Dr. Harvey said, we only have horrible choices. That's all we have is horrible choices. So, which horrible choice are we willing to go with is really, and I appreciate, my concern is that we are constantly asking our administrators to come up with new plans, and I feel like that is taking time away from what they could be doing to actually be supporting our teachers and supporting our students and whatever, in their day-to-day interactions with them. So I hear what you're saying. I would love to, but I just don't think it's out there. So I think we just have to either decide, we're gonna go for it when it's safe, obviously when it's safe, and we're just going to go for it and try it, or we're just going to keep things as it is until it gets to a point where it truly is safe to, because of vaccinations or what have you, to really bring kids back in.
If I could just I think Denise is responding to me, so I'll just quickly respond to
Yeah, and
that.
I didn't mean just to say, it's just that I was responding to your comment, but I'm just saying this in a general way, is that I think we're just going to have to bite the bullet, is what I'm saying, in terms of making a decision, rather than keep saying, come back with another plan, come back with another plan, come back with another plan, because that's what we're hearing the community is frustrated about, is we're just not making a decision. And I think what I heard from Barrington was they would almost rather us say, we're just going to stay remote, because that's what we feel is the least bad option. What I heard from the Barrington meeting is that they would rather hear that and know that that's the plan than continually just be on the fence. Maybe I'm wrong, but that was my
I
interpretation.
think the frustration lies where we've been winging it kind of the whole year, and winging it is not cutting it. And I think that's the frustration that I'm seeing with the people here in the district, is we're winging it, and it's not getting us anywhere. We have to have a plan. We have to have a better plan. And you have to have a plan so you can make the path to get to that plan. So bringing back plans, that's part of the process. And we have to find, I think I don't know if I'd go as far as the board admitting that we've made some mistakes in the past, but I think we've had some bad outcomes to the decisions we've made. And I think we have to admit that we've had some bad outcomes. And the only way we're going to get there is to have that path. And we got to set that path. Part of it is communication, which I heard from Barrington was communication was a problem. And whatever plan we have to have a plan and put it out there so the taxpayers and the parents know what we're doing. Because a lot of them have no clue what we're doing.
So there's a difference between having, I appreciated the distinction between urgency and determination to determine what our model is going to be, and then watching the external conditions on implementation. So we're clear on that distinction. I hope the community is clear on that distinction. Nobody's saying we're going back. We're making these transitions in early January. However, the gap between the Monday, Tuesday flex model currently and the 50-50 model, where there's up to there's significant asynchronous time, there are models in between. We see other high schools going about it. I know Dr. Morse and Suzanne have been playing with some of these as well. So I think it is fully within the board's mandate to ask for, go back to the drawing board and bring us more options that are in the middle. We may find in January that, they've tried their best and haven't been able to reach it, but I would like to do that. And with the date of January 6th or January 13th, if you need the additional time, we could say by the end of January that we would choose what our high school sort of opening, what our hybrid model is. And then there may be, smaller improvements as we are getting closer to the date where it actually is implemented, but at least we would have a core that we could communicate to the community to look forward to.
Suzanne, since you're up here, we're supposed to be talking to you, but is an obstacle to your plan, or is it an obstacle to your plan, the amount of staff that's in the building right now? Are they coming in?
Are you asking me if the flex model that we currently are using is able to continue with faculty being out?
Well, no. We're shooting for phase 3. Okay, at some point. Are we going to be able to do it with the way the staff is now, as far as being in the building? Okay.
If we were in phase 3 and we were at 50% in the high school, I would not have the staffing to be able to sustain it right now.
Is it staffing because they're out with, either being quarantined or tested, or is it because they're not in the building by choice?
It is because they are out because they are quarantining for COVID-related.
Okay. So if the numbers do get better, which we're all hoping they do, we don't have a crystal ball, we don't know, but if the numbers do get better, you feel that we can reach that phase 3 point at some point if the numbers are better, you don't lose the staff that you've lost now?
I think that what they said today is a perfect example of what we're experiencing, what the doctors said. We are a direct reflection of our community right now. And so every single day, our nurses are working tirelessly to contact trace, to educate people, and we don't even have our full student body in the building, and they're still doing that with students that are not in the building. So I think that we would need to be at a point where the community spread is what we would be able to maintain inside the building also. So I think that was a perfect statement.
Michael?
First, I'd like to, I think, address Megan's question about metrics and decision-making. So this is what Megan Harvey provided and what Dover is using. I'm really glad that there is a good set of objective measures that we can look at. But this isn't criteria. This is information. This is data. I think if we're going to set criteria, that probably is on the school board to do that, to say, how are we going to use this? These look like they're following mostly what the state health department, how the state health department bucketed in-person, bucketed low, medium, and high risk, and how they approached it. Specifically regarding the slide, Suzanne, on slide 18, which you talked about briefly, there's a lot of, this is faculty adapts to meet student needs on the academic side on the left, and on social emotional challenges on the right.
I have to get there, sorry.
Yep,
okay.
There we are. So there's a lot of overlap, obviously, between the left and the right in different order. How did you ask this question? Was this multiple choice, or was this a free form answer sort of?
That's a great question. So we had options for people to choose, and we asked them to pick 3 of the options, and there were many options. Those options for the challenges and the strengths were identical, so that they would be picking from the same grouping. We also had an area for comments, which we pulled information out. So, for example, on slide, and then I'm trying to remember which slide it is. On one of the slides, we asked the way in which the words are up atop. That's exactly how it's worded in the survey. So I cut and pasted that in for you. There's one slide, just give me 1 minute to find it.
What were some of the things that were not chosen? Because clearly there was a lot that were the same, but what were some of the things the options that you offered that were not picked for either?
I need to go back in and look. So some of them are really kind of similar. So one of them would be, I have to go back in. Let me. Suzanne, can you pull up the form? Yeah. Can you pull up the form? Those are great questions, Michael. I just don't have them on the top of my head.
Yeah. So while we're looking for that, on the next slide, which is the grade comparison, so I understand that these numbers are pretty small overall, that we're talking about, between 1.5% and 2.5% of grades across the freshman class being Ds or Fs. I wonder where would you be concerned? At what level would you be concerned that you thought you were seeing an increase that was concerning? Because the current year is 50% higher than any of the other years. There are 50% more D and F grades now amongst the freshman class than there were in any of the previous 3 years. It's 2.5%, but it's 50% more than it was last 3 years.
So I would say that these are 7. So there's 7 from around 1,300 grades. Mm-hmm. So when we get concerned, it's when we see students that have, when we look at individual students, and we see, and it's more about the student themselves and what the grades are telling us about them. So if we see a student that's earning multiple Ds or multiple Fs or a combination, that's when we would dive really deeply. And so This is, it is, I can say that the numbers that you're seeing there are not, they're not all different kids, right? So it's not necessarily just about the number of Fs. It's about, is that one child that's earning 2 Fs and a D, and that's when we start to really dig a little bit more deeply into it and say, what is going on? Is the student coming into the building? Are we doing what we need to support the child? That type of thing. Overall grades, we could talk about what grades tell us. I was asked to do sort of a longitudinal look at the grades, and so that's what you're seeing. If I saw, if I saw that there were like 20 D pluses and like if it was, that would be significant to me. Like, and if you look at the standard deviation and you think about all these other things, I mean, a 3% going up and down is not necessarily going to make me think, oh my gosh, there's like something serious going. But if I saw high numbers, double digits, high numbers in each of them. But I think that grades help us when we look at individual kids. They don't necessarily always, and when we look at trend, but this to me is not a significant difference.
We also don't get the kids that we hear a lot from parents, that they would have gotten a B when they were more engaged. Now they're getting a C and they're sort of disengaging. Like this isn't part of this grade analysis.
Yeah, so we track, we spend a lot of time monitoring kids. Counselors and administrators are meeting weekly. They go over students. They talk about students. They're tracking, leadership is constantly tracking grades. We're tracking attendance. We're tracking all of these different types of things. Faculty have been absolutely amazing at reaching out to counselors and reaching out to each other to have ongoing conversations about students. So I think that that's really where we're digging into the grades. We're really looking at the individual kids.
So it sounds like that's the information that we would really want to look at if we were trying to understand how is this year compared with previous years. If you're looking at number of students that have multiple of these, or so this is not the right measure, is what I'm hearing you say.
No, I mean if you want to sit down and talk about how we determine who our targeted learners are, I'm happy to do that with you.
No. The question is this year worse than last year? Right? That's the question we're trying to answer here.
With grades or with?
For the academic program that we're delivering to our high school students and specifically our freshmen.
So I think we're in a pandemic. So is it going to be more of a challenge for our faculty and our students? 100% yes. Are they making curricular adjustments to meet the challenge? Yes, they are doing that. I think that this is a big struggle for everybody, but I would say that the faculty are doing an amazing job in meeting the needs of our kids to the best of their ability in the mode that we're currently in. It would be remiss of me to say that this is not the most challenging year that we've all experienced. Depending on what people have in their own personal lives and what they've experienced, maybe it's not, but for the majority of people, I think it's probably one of the most difficult times that they've experienced.
I think where this really plays in is we're trying to figure out what's the right balance between remote and in-person time. And I'm hearing that around the table here tonight as well, that if we think that in-person time is more valuable, how much more valuable? If in-person time is twice as valuable as remote time, then it's kind of a no-brainer. You get as many kids in the building as you can at the cost of as much asynchronous time as it takes. But if it's not that, then there's some other optimal point.
Yeah, and I think there's trade-offs with that. So if we go to in-person, and I don't know if you're asking my personal opinion, if we go to in-person and we lose the 50% of instructional time, teachers are very concerned about that. They're very concerned about losing that instructional time with kids for curriculum progression that also means they're losing synchronous time. So even though now the teacher is sitting with the student in front of them, they then will lose that student when they go home for half the day or for a full day or whatever the model has. So are they worried about that? Absolutely, they're concerned about that. They have the same concerns about asynchronous time that everybody else does. Again, there's trade-offs, right? In person, you're in person. There's benefits to being in person. I can't answer that question because there's trade-offs with everything. There's no good answer.
Obviously, there's trade-offs with everything here, and like we've said several times tonight, no, best of bad options, right? We're trying, I think that where the objective data, whether it's this or whether it's this, is really important, is that around the table there are 9 of us around the table. There's probably 20 opinions about what the right thing to do is. And if we're just going on opinion and how we feel about it, we're not going to get there. And we've been in this paralysis mode for months. And we need to have something, a common baseline to help us move beyond that. And so I was trying to figure out if this is our common baseline that helps us understand that, and it sounds like it's not.
I don't think it's really, no. I do think that there are some kids that are thriving in the remote setting. There's some kids that are okay, they're doing what they need to do. Would they rather be in school? Yeah, we would all, absolutely, we would all rather be in school. We'd all rather be back in the fall of last year. And there are kids that are struggling. And so I think that whatever decision is made, that pendulum will shift over to those kids. So the kids that were thriving in the fully remote may now struggle because they have more asynchronous time and may need to stay in remote. But the kids that needed to be in person now are getting that in-person contact, so they're going to start to thrive. So that may shift a little. You may start to see who our struggling learners may shift a little bit when we shift our model. And so that means that counselors, administrators, teachers, everybody's just going to have to continue to be vigilant as we shift, if we do shift to a new model, how that's impacting the kids.
So I have 3 questions on slide, what is this, 21, and then I'll
Sure.
be done. Okay, so at what point, how much in-person class do we have to have before we can have Wednesday be either a normal synchronous remote day or a normal in-person day?
So first of all, I would say that this model is only one 50% model. I know that I'm constantly building models. I just have to say that. This doesn't just stop when I walk out the door. So I have 2 other models I've been working on in the last couple of weeks, and one of them is not this one that I think that I probably will move forward and have you look at. I don't know. It's hard. Wednesdays are hard because it's an off day. So because we have an AB model, because we have an AB day, we have a blue day and a white day. Wednesday's like an off day. So what we've done in the past is we've had Bobcat days. Bobcat days are when you go through all the classes. Well, we've been hearing over and over and over again from kids and from teachers this year that they don't like the Bobcat days. Things are moving too quickly. And you hear it from kids even on the flex days now. They're saying the schedule's moving really too fast. I have no breaks. And I think the Senate actually talked a little bit about that this morning. So there's a lot of concern about that Wednesday and those 30-minute classes. Mm-hmm. If we went to a blue day, white day that just keeps revolving, we would have to do that just keeps revolving. And
Right.
that's something that we could look at.
Okay. And then what you have below the or is really interesting here. Depending on numbers, reassign teachers and kids to create a remote school. Is that really viable in the middle of the school year? Because that sounds like a really intriguing option if it is.
We'd have to do a lot of reassigning.
Mm-hmm.
Which means that kids that have started to adjust to teachers would now be shifted and moved to other teachers. I think that is similar to the conversation you had about the middle school. Mm-hmm. It makes me really nervous, to be honest. I think that there is a better alternative to that.
Okay.
Which I hopefully will present to you.
I was interested in that because that's what we did in elementary in the summertime, and it's been working great for the whole school year so far.
Yep. I think if we had started with that, if we had a remote school to begin with and kids were assigned to the remote school and they only
Right.
had certain classes they could pick and all of that, that's different than shifting now.
Yeah, okay. All right.
So I was trying to actually just to piggyback on what you were trying to say, Michael, especially about the criteria. I mean, that's why I was trying to say, instead of like having 50 models that we're, always picking apart and trying to second guess ourselves, what is the best model and what's the justification for it? So that should include, this is why we think this is the best. And I hope that gets us past the paralysis because you have something to hang your hat on. It may not be the best, it may not satisfy everything, but it's the best of the worst models in the opinion that they can work through.
Do you think we could agree on a set of criteria to evaluate that?
We should, but I mean, again, I'm trying to think that it's hard for us, I think, as board members, but none of us who really are professional educators at this current time, to try to make those criterion decisions. And so my real hope is that's the use of the administration and the faculty. They have the most expertise in this, and in their justification should really come, this is the criteria they thought was the best to give them the best pathway of success. I think of myself as kind of the bureaucrat here. It's like, okay, you've told me that's the best model. How can we make that work? If you need money, if you need transportation, if you need equipment, that's where the board really comes in. One of our biggest things is money. And so we're the backstop. When you've told us this is the best, this is the criteria that's the best, you told us the limitations that you think are really bad, our job is really to try to make that happen and then to allow you to try to adapt to some of the limitations. So I'm not trying to punt, but I think that's the best way I can think of it.
I'm just wondering, we're going to have to move on because we're going to have another presentation on the middle school. Is our directive to Suzanne to do pretty much what Al said, is to develop what she and the staff thinks is the best model, explain why they think it's the best model. That does not mean that we have to say yes to it automatically. We can ask for a modification, but rather than have her come in, because I think, we talk about paralysis. I think when we see 5 or 6 different models, I think that's been very difficult for us. I think to say you're the professional, you have access to other professionals in your building, develop the model that you think best accommodates these trade-offs that we've been talking about. Bring it, show it to us on the 6th or the 13th. Then if we say, look, this is, the trade-offs are too painful or whatever, we could open that up again. But I think rather than, well, that's pretty much that's what my, if we're saying, come in with 5 or 6 different models, I think that's been a very difficult time for us. I think we have to be clear what we're asking Suzanne to do. And that's, my preference personally would be come in with the best model that you could come in with that accommodates the trade-offs the best as you see it and as your staff sees it.
I think it might be helpful for us to be slightly more directive or recommending, simply because that's what we had asked in October. And between step 2 and step 3, the step 3 had too many trade-offs, even though that had been the directive. So I guess, and what I guess we're seeing is that looking at other districts' models, maybe it's that maybe there are more variables than we thought, how the instruction takes place. I would just put out there, I would be looking for a model that had 1 or 2 days as an in-person option, no more than 1.5 days asynchronous time, whether that's 1 plus a half or 3 half days. I'd be looking for remote students to not have a penalty on synchronous instruction. So the slide 21, for example, looks like the remote students really get much less synchronous time. And I would want, everyone is going to have an asynchronous penalty, but I wouldn't want the remote students to carry more of an asynchronous penalty than others. I would want to privilege the 9th graders and second, the 12th graders. And I would want low switching costs, again, for an individual who quarantined a classroom or the school going back and forth.
So could I make a suggestion that we allow Suzanne to build the model, the best model that she can come up with, and then each of you can use whatever individual criteria you want to use against that model? Because, you know, if we follow that recipe you see, we'll still be spinning our wheels. We need to get a model in front of all of you that you can critique, that's based on the judgment of administration and staff, that in this time period meets the needs of our students to the best of our ability in a pandemic. And I do know, based on the draft that I've seen that Suzanne's been working on, and she shared with her staff for governance committee today, that, you know, I think that she's developed a model that is doable when COVID allows us to implement it. So we'd like to get that model in front of you, and then you guys can have at it in terms of whether you like it or not. But we've got to get something in front of you that says this is where we want to go, and then as the board, you can critique it at that point. That's what I would like to see us be able to do administratively, is get a model in front of you that we feel is the best model that we can develop at this point in time.
There's certain things we can do now, though, and it kind of hit me this morning when we were on our student senate call, which was excellent, by the way. Thank you for setting that up, Megan. Everybody was engaged. You know, everybody was involved. That's the biggest complaint I hear, is students are not engaged. And I think it's because they have their screens off and they're not engaged. And to me, personally, that's the equivalent of having your head down in class or sleeping in class. You know, you're just not engaged. And I think we can take care of some of these issues without worrying about whatever phase we're in by having a policy of putting these screens on. Because it is the most frustrating thing that I see out there that other parents have seen and have commented on every time I go out in public. And it's extremely frustrating. I don't know why we don't even talk about it as a district.
We can talk
overall.
about it, Brian. I've got a legal opinion on it, and we can't mandate it.
Can I?
You know,
I mean, I think that's
I understand. I mean, it's wicked frustrating for the teachers and
But
for
if
the students alike.
if we set a policy even? Because how come other schools can do that?
The only way that you're finding other schools do it is they're simply taking a position, you're going to do it. And if a student says they don't want to do it, there's no way to mandate it.
To just interject on this because of what we've been talking about in the Student Senate, the Senate is trying to address the camera use issue as the year goes on, and I think that there's definitely there are students who feel strongly about not having their cameras on, and there are students who feel strongly about having their cameras on, but I think by and large what most students are doing is seeing other students with their cameras off and being like, oh, if they don't have it on, then I won't turn it on. In the Senate meeting today, everybody felt like that was an appropriate time to have their cameras on. They wanted to be heard, they wanted to connect, and because everyone had their cameras on, nobody felt like they could have their camera off. And so the Senate is really working to address that, and I think that though, I mean, the school board can, mandate policies, or the school can mandate policies, but really the only people who are going to be able to get to the students to do things are the students. So really focusing our effort on trying to get the students to convince other students and really understand how having their camera on affects their learning.
I also think the model that Suzanne's going to present to you on the 6th is going to be able to address that.
Could I just ask for transparency with the community? What is different now than October when the first round of models were presented?
We keep on refining and trying to figure out new ways to do the work. And every time that we put out a model that has a deficiency, we don't just stop. We keep on pounding out a new model. And the particular model that Suzanne is working on now, fortunately, is in compliance with the MOA, doesn't violate any guild contract issues, and it's taken this long to come up with a model that meets those criteria, much less the criteria you outlined, UC. And we have it, and we have screened it through the guild leadership, and they see no violations to the contract. And so, we just really would like to get a model out that you guys can focus in on.
I'd like to draw this to a close if I could. And it seems to me we're not unanimous about this, but there seems to be a sense that there is a model that's being developed. Bring that model before us, work on that, bring that model before us on the 6th if you need more time. Then we can look at it and, evaluate it. I think, it seems to me it's a promising model based on what you've said. Is that a sensible way to go forward?
Will it be the 6th? You said or more time, but I think if it needs more time, I think we've talked about it.
I can have it to you by the 6th.
We can have it on the 6th.
6th, okay. Is that agreeable?
Yes, could it be presented with, not that takes a lot of other time, but just, I like having other models to be able to sort of kick the tires as pros and cons, the ones that you've already developed. Otherwise, I can find them from past PowerPoints, but just
Can they
to
put
have
that
this
in your
as a
packet?
reference.
I'd like the focus to be the presentation of that model. We have probably a backlog of models that we've looked at. So is that agreeable?
That's the only thing to answer yours, UC. That could always go in the backup. It doesn't have to be the presentation.
Exactly.
Just so it's really painful to have to go dig through the old things and find out.
And I do have to
what's all
say
sitting there.
that as the year progresses, criterias have changed. And I know that sounds a little strange, but our buses have changed. The elementary school models affects the high school model. The middle school model affects the high school model. There's a lot of other things. So even though you're going to see a model from the beginning of the year, it doesn't necessarily mean that we can still implement that because things have changed as the year has progressed. So I'm happy to bring all those models to you so that you can see them. The ones that we worked on over the summer, the MOA hadn't been decided at that point. So, there are a lot of things that have changed over the year itself as I've developed the models, which is why I'm continually developing them, is because things are continually changing and shifting and adjusting. So I'm happy to bring those. And I'd like to say, you see that some of your points that you have brought up are things that we've been thinking about. So you will see some of that overlap, not necessarily all of them, but some of them will be addressed.
Okay. So are we in agreement? Okay.
Michael, if you'd like to see additional information about that survey, I'm happy to share it with the school board if people would like. Just let me know what it is you'd like to see, and I'm happy to share that with you.
Okay, great, thanks.
Thank you.
Okay. I'd like to suggest that we have Megan do her presentation, her report, and then take a break. And then if you choose not to stay for the second half, that's fine,
No, I'll stay, but yeah, I can do the student senate report now, or student rep report, I suppose. But the first thing, which has been addressed a couple times in the meeting, is that the school board met with the student senate today, and we had a meeting via Microsoft Teams that went very well, I think, and I think a lot of students also felt that it went really well. Questions were asked of both parties. There was a great discussion that went on, both about going back to school, about camera use, about activities, winter sports, things like that. A lot of the students in the call expressed that they were not comfortable coming in personally to school due to COVID-19, and I know that other students have expressed differing opinions, saying that they would actually be comfortable. And so, in the interest of getting an entire representation of Oyster River, I don't think that all of the opinions expressed in the meeting today were entirely representative of Oyster River. I think that there are students who do feel comfortable going in. There was a student who spoke in the public comment section. I think it was in response to that part of the meeting where many more students said they weren't comfortable going in than they were. But obviously there are students who aren't comfortable going in, and I think at this time especially, really no one is considering in-person a viable option, as we've decided not to have the in-person days. It's right now, New Hampshire and our community, and with the holidays, it's just too much of a risk. But as we move forward and considering the plans that Mrs. Filippone is going to bring to us on January 6th, I think having another meeting with the students would definitely be beneficial to get their input on the models, because even as the administration makes the models and as we have our own criteria, they're really going to be affecting students the most. And so getting student opinion on how they can be implemented, what they think about that, the student views on synchronous versus asynchronous, which seems to really be like kind of what we're talking about when we discuss these different models, is it's really just like the ratio of asynchronous to synchronous. I think having another meeting would be really helpful for that, if school board members would be amenable to that, if anybody was. And then, yeah, I think the only other thing that I wanted to mention is just as we move forward, just making a plan. You know, as I said, students don't think it's realistic really to be coming back in right now at this moment, but having a concrete plan that we can implement at a time when it is safe, and again, establishing that criteria for what it means for it to be safe enough to come in, and then having an idea of what is going to happen, just so that we aren't kind of left wondering, oh, well, when the numbers clear up, you know, what will it look like? We can at least know, okay, we might not know when the numbers will clear up, but we at least know what it will look like when they do. And as we approach the end of the first semester, you know, we're running out of time both to come up with a plan and to implement it. And, you know, the longer we wait, the less chance there is that there's really going to have any significant impact. I mean, if we don't make a plan for coming back in, we could not get something implemented until like April or May, and by that point the school year is almost over. So I think having a plan set forward now will be most helpful moving forward in the future, and I think a lot of students are looking to see that. And that is all I have. Thank you.
So I was wondering if we could take a 5-minute break now and then move into the middle school.
That's a Tuesday?
As projected, I think Wendy kindly handed that out to all of you. Try not to take up too much of your time, but more than happy to answer any questions. I do have the PowerPoint with me, so if there's any particular slide you'd like me to address, I'd be glad to do that.
Hold up, Michael's not here.
Missing one.
Oh, sorry.
Yeah.
Oh, is that bad that we didn't notice?
I think he's coming in.
There he is, I'm sorry, okay.
Little strips,
your tardy.
but I brought one too.
Oh, okay, yeah,
Go
of course.
go ahead, Jay, sorry.
Good. All right, again, just out of respect for your time, I have prepared a summary for all of you that Wendy kindly handed out. I do have the PowerPoint if we have questions at some point later on. I'll just try to be brief. Where we're at in terms of the hybrid model that you did approve. Just a real quick review, it's students would come in 1 full day per week by the alphabet. As a reminder, 5th and 6th grade would come in on Mondays and Tuesdays. Monday would be A through K, Tuesday would be L through Z, same thing with 7th and 8th grade on Thursday and Friday. And a key component to me is we would keep our targeted learners on Wednesdays. Some of the benefits of our hybrid model, of course, having the students in person 1 day per week. That would be 25% of our students. No student or teacher or team changes. No case manager changes. And again, this schedule is designed to easily go between in-person and remote. So if the board decided we need to go remote for whatever reason, the schedule is very, very similar. Some of the challenges, you get an increase in asynchronous time. Asynchronous time, as you all know, it's not a fan of anyone, particularly our teachers. What they want to do is they want to be with their students, whether it's in person or remote. An increase in personnel. We're already in the planning phases of that, where that's been posted, and we plan to interview candidates very soon. And that would be 4 paraprofessionals. Another challenge is just the transition time. What that would look like, and we thought it was very important to map out a timeline for you that you have in front of you. These are action steps that we will be doing right when we get back from the break. We're going to survey parents, and they're going to need to get back to us by Friday, January 8th. We'll also do some Microsoft Live events that we've done before. Make sure I'm available to answer any questions from parents. We'll do that during the day and in the evening hours. And also, create newsletters, correspondence to make sure my families feel informed in terms of what we plan to transition to in late January. Following week, transportation is very important to collaborate with Lisa Huppy in her department. I've mentioned that several times over the past few months. Training the people that we bring aboard. We want to make sure they get them appropriate technology training, lay of the building, how we provide appropriate supervision to students, and also playing with Doris in terms of what lunch would look like. The week of January 19th through the 22nd, can just make sure everything's ready to go, confirm with Lisa in terms of transportation routes, make sure we get that information. It's very important to families. Start to have some teachers come in to make sure their classrooms are prepared. Classrooms are prepared right now, but just, final touches. Make sure teachers feel good about the appropriate spacing between desks, etc. Make sure our mapping continues throughout the hallways, stairwells, things like that. Little things can happen where some of the stuff might need to be replaced, but again, that's just minor. Make sure we have our COVID safety plan completed that week, coming and going into the building, where the kids are going to meet to get on buses. We're practicing this currently, but again, the numbers will be a little bit higher, so we just want to make sure we're set for that. And then lastly, the week of January 26th through the 29th. And we just need to continue to have the green light from you. I mean, we'll be ready with this plan whenever you tell us to start it, and our plan would be to start it, for Q3, when that starts, on I think that's Tuesday, January 26th. We have a teacher workshop day on the 25th. So that's when we'll be ready to go. Glad to take any questions in regards to that summary. Yes, Denise?
So there was a memo from Dr. Morse about fifth grade, and I didn't quite understand why they would be losing time. And is there a possibility of keeping, if the fifth grade model, if it's best left as it is that a possibility? So
Yes.
It's really two questions. What's the issue? And if it is an issue, can we just keep fifth grade the way it is?
Great question. So fifth grade is a targeted group, so they currently come in Wednesdays in an AM/PM model. So this model would be a change where they would come in a full day on Mondays and Tuesdays due to the alphabet, and then they would change to just targeted learners on Wednesdays.
So they come in 2 days a week under this, right?
Right now, they're coming in 1 day per week on
But in
Wednesdays.
this proposal, it'd be 2, right?
No.
No?
It would be 1 full day, Al. So currently, if they come in 1 half day, it would be 1
1 half.
full day.
Got it.
Correct.
Not even
No,
one and
no.
a half. Currently, they come in for a half day. They would gain a half day, but they would lose 2 synchronous days.
So again, is the second half, is it possible to do this model and keep fifth grade as is?
Correct.
It is, okay.
Yep. So what we could do is you could just bring 6th and 8th grade through this model and continue with 5th grade as it currently is.
There's survey data in here for the 5th grade, but I didn't see it for the other grades.
Survey data in terms of, I just asked how the 5th grade teachers felt about, the current model and transitioning to the other model. And again, they felt like they would like to stay with the current model of them coming into the building AM/PM on Wednesdays and continue with synchronous learning on Mondays, Tuesdays, and Thursdays and Fridays.
That's great. I was actually referring to slide 3.
Okay. I'm sorry, Michael.
Sorry, the slides aren't up. So slide 3.
The student responses.
Which I think it says based on parent survey, 93% of 5th grade parents responded. But the survey went to the whole school, right?
It did, but just looking at 5th grade, because that's why the numbers are a little, are you talking about slide 3 from the PowerPoint?
The numbers in the remote and in person are not, those are real numbers from the real survey, right?
Yeah.
I'm sorry, what was?
I'm having a hard time hearing you, I'm sorry.
Do you have the survey data for the other grades, for 6th, 7th, and 8th grades that you can share with us?
Not in front of me, but, we did survey, but this is from back when we did that, was several weeks ago, in terms of asking if they wanted in-person or hybrid. We have that for across the school, yes.
Yeah, I think that would.
But not in front of me.
Right. So if you could send that to us, I think that would be good.
Pretty sure I shared that with you already in past presentations, but.
Not by team.
But we can resend it.
Okay.
Yeah.
So thank you for digging into this and answering some of the questions. And it's great to see the actual schedules. I guess one, to Michael's point, it's possible that the data the preferences will come in not at a 3/4, 1/4 ratio. And so some classes may be bigger and smaller, and
Correct.
you're planning for that. Also, in terms of the negatives, it seems like there'll be 3 classes per week versus 4 classes per week, and that's just the way that's the trade-off that we're all talking about. I appreciated the timeline, and I think if we could make really clear in our communications that for families, even though they're answering the survey in January, that we are, we're not talking about going back. For sure, on January 26th, we're looking at the spread. These are 2 different decisions. That'll be really important. One question I have is, say community spread is still really high. We shift in Q3 to the new cohorts within the teams, so it's the 3 hybrid and 1 remote, we think.
Yep.
Would it make sense if we aren't ready to actually go in person to continue with the, shift the cohorts around so that they're ready to transition, but
Okay.
not actually have asynchronous time when it's not necessary? So continue to have 4 days a week of remote classes, and then only when the students are ready to go into school do you start to sacrifice?
Right.
Yeah.
Okay.
Totally.
That's exactly what would happen, you see. So I had asked Jay to put in, an optimistic timeline, and so he shot for the third quarter. But again, it would be completely contingent on a green light from the board. So he'll do all of this work and be ready, and then we have a meeting on the 20th, and you all can decide whether you want us to implement on the 26th. We could do-
But in any case, the students will switch to their new cohorts on the 26th. They just may not come in person.
I'm not following you see, because there's no change in student assignments in this model. So
There
when you
are,
say cohorts, what are you saying?
However you would describe within a 4-class, however, please,
She's talking about class sections on the team.
sections.
Right, okay.
Sections in order to have a remote section.
And it would be, A through K, we would do an L through Z. Is that what you're talking about in terms of the students coming in?
You're going to survey.
Bill, do you want to answer?
On your teams, you would have, currently there's 4 separate sections.
Correct.
In order to do this, you're assuming one of those on each team is going to be the remote section. And I think what she's asking are you preemptively, heading into third quarter, going to organize things that way so that when the time comes to do it, you would be able to do it, whether it's the first week or the third week of the third quarter?
Correct, yes, yep. And again, these numbers work right now, you see, it's a great point in terms of we looked at those current numbers and being able to do that one remote section, and the numbers work right now, yes. But if we had significant changes, again, just like you cited, some of that might change in terms of class sizes.
But my concern with that approach with the schedule is that if we don't have objective criteria for saying yes or no on January 20th, parents are guessing what we're going to decide, what our threshold is when they register the first week of January. And it's going to be a different answer than it is at the time.
Right.
So it seems like we probably, if we're not going to establish objective criteria, if we're not going to decide where on here we need to be before we move forward, we need to make that decision before parents register for in-person, for hybrid or remote, meaning we'd have to make that decision on January 6th instead of January 20th.
And you can't have an unknown. It's like, so the parents, the parents should know what the criteria are for us to move forward. And even, they can even, tell them where they go look to see where they are in the criteria.
Right.
It's even better.
Yeah.
So that takes the what I hope to do is take what's an amazingly fluid and unknown situation and to provide some known so that parents can say, well, I'm looking at it and I've seen that the positivity is 10%, for sure this is not going to go in. So, I think we definitely have to establish that as we move forward so that parents have a clear sense of where we are.
Just as to push back slightly, we're fortunate that we have our elementary schools already in person. And so we want to reopen the elementary schools as soon as possible. And we haven't said it's 4 out of 10 for the elementary schools. So I would think it could be the same criteria. If we have open elementary schools, then we should have, in-person middle schools and high schools.
My response to that is we heard our presenters say, even though it's tentative evidence, but there's some tentative evidence that says that elementary school children spread the virus less than older children. And so to me, what that means is it's safer to have elementary students in person than it is for middle or high school. So that's my interpretation. I know that's tentative, but, to me, in my mind, that's how it makes sense to be able to say, there very well can be a time where it's safe to have elementary school in person, as we've been doing, but not middle and high.
I think we've heard a lot of community feedback just through email and some of the voices here that they might say, I like Model 2, but it's not the right time. So if we don't articulate, if we don't articulate objective criteria and we haven't told them whether it's going to go or not, those are the people that are going to say, even though I like this idea, I'm going to sign up for remote because I don't know what they're going to know which way it's going to go. And it's not the right time.
The other option would be in this countdown, we talk about the countdown to launch, having the survey be after the decision.
Yes.
And so that's, I talked about like this 19-day countdown where in the first few days you do the survey.
Yeah, I mean, I'm trying to, so the thing is, you want the people, when they know the survey, what the criteria is to open, so that they can look at it and say, you know what, I'm not comfortable with that, I want to do the remote. But the people who want to sign up know that there's hope that actually, when we meet the criteria, we move forward, so that we're not just stuck.
Megan?
I was just going to say, I think based off of what we saw tonight and also all the reports and what we're considering going back in, I think at least outlining very basic criteria, just like, and like we keep saying the word criteria over and over, but really talking about like specifically like cases in the community spread, contact tracing ability, which would fall on like administrations to really develop, okay, how could we do that, or what are our capabilities of doing that, and making that known to the public. It doesn't have to be the most comprehensive list of, okay, when it's exactly this, and when it like the situation is exactly like this, but at least knowing, okay, we definitely won't go back if this is the case. Like at least what will we just certainly not go back in? And then maybe there's that wiggle room where it's like, well, maybe we could make it work, maybe we couldn't. At least outlining that at this point, I think would be tremendously helpful, because as it is, we do really have nothing. And I think that most of the frustration that community members are expressing is not with the fact that students aren't in person, it's with the fact that we just don't know when, if, how they will come back.
So would the board be, like, would we charter an ad hoc subcommittee to take a look at that and bring a proposal on January 6th along with?
I think we've had more than enough committees. I mean, I'm looking at our administrators that are pretty much out every night with one committee or another, between the curriculum committee and the finance committee. And so I think we have it right in front of us. I don't see why we can't, as a group, decide, either like the 4 things or whatever that we want to pick out of this whole list, or just say we're just going to stick with the lowest risk category. I don't see why we can't do that as a group.
It will take an hour or 2, but we could do it.
I don't know that necessarily it would.
So we need to have that done by when's our next meeting? The 6th.
Yeah.
So by the 6th, we really have to have decided the criteria, because we're going to ask parents on the 8th. So I'm trying to figure out what the most time-efficient mechanism, exactly to Michael's point, we have to have that the 6th.
Why don't we just find out right now kind of where board members feel in terms, maybe it's as simple as saying we're only going to go with the lowest risk. I don't know where people stand. I certainly, when I'm looking at this, I think we can say high risk, we're not in person. I don't think there would be anyone that would going to be object to that. Are there people that are comfortable being in person with medium risk? I don't know.
I think, the only area of discussion really, we can establish that, okay, with the lowest risk ratings, we will come back. With the highest risk ratings, we absolutely will not come back. And then it's the medium risk where we have that kind of discussion happening about, okay, what is and isn't, serious enough to consider. But as long as the community knows, okay, at lowest risk, we definitely will come back. At highest risk, there's no chance of even having that conversation. And then within that medium risk.
I like the way both of you were going. I would feel uncomfortable putting a, very precise criteria for, where it's 7 out of 10, or whether these 3 are most important to us. I think that we would need scientists on the committee, or, medical professionals to go more deeply. I don't feel that we have the capacity to do that. What I do think we could do is say, like, personally, I would feel comfortable with the medium, imminent risk trending down, with also looking at staff availability. And I would be open to considering, like, no more than 2 high risk or something like that. But I think I would prefer just to say that it's medium trending down.
So I guess, okay, personally, I would think to do this now around this table makes me feel uncomfortable, okay? And I also feel that you have other metrics. I mean, this is a metric, in some ways it's radically more conservative than the state metric, okay? The state criteria, if you look at the state criteria, the numbers are quite a bit different. So are we, I think we should know, before we say we're just going to go with these criteria, we ought to kind of look at it in juxtaposition to some other models before we just latch on to this one. I mean, not to be critical of this one, but I think doing it around the table right now would be a mistake.
So my suggestion, we have a nursing staff and a health committee. Can they take a stab at this?
Yes.
Come up with what they think is the best criteria, come back on January 6th, give us a recommendation. That'll give us, instead of us, what could possibly be wrong if I do surgery on somebody around the table? It's like, so it'll give us really a better guidance to do it, and then we'll be able to then have it in place for when you do the survey on the 8th.
And to build on that, one of the things I feel like I heard tonight is that there is no single algorithm even that they could recommend. It really is specific to every district. There are unique criteria here in our district that don't exist in others. And this is one of the things that has made everything so challenging, is while it would be great to be able to take a model from another district that seems to be working well, we don't have the luxury of assuming everything's applicable here, right? So I think Al's exactly right. I think having our in-district health experts come back to us with their perspective. Dr. Morse, obviously the limitations around staffing, trends in that regard play into this. We have to come up with our own algorithm. So I think the extremes are easy enough, right? High risk, low risk. It's that in between that triggers a transition that is really difficult to figure out.
What do you think of also, you were talking about having the presentation on the 6th, and I think that's great, but with the assumption that those are paired, what do you think of the idea of having the survey after the countdown starts instead of before the countdown? Okay. Because that would, it's important for us to be able to communicate the criteria, and the parents would be very certain what our criteria were because we had said it would be open.
It's tight. I know what you're saying.
Right.
It's like, because, hey, you got 2 days.
Right.
So are you comfortable with Al's idea of my putting the health people to this task and coming back with their recommendation on the 6th?
I am comfortable with that. It saves you folks from having yet another evening meeting.
I guess what I would caution, I think that's a reasonable approach to, and I value their input. I think we should be cognizant that patient care and epidemiology, or patient care and public health, are 2 different disciplines. It's one thing to be able to treat an individual patient, and it's a different science to look at community spread and transmission. That's why, we have a PhD epidemiologist tonight and not an MD. Right. So I think that's important input, but we need to make sure we view it in that lens as well.
Yeah, I think the nurses can look at this through the lens of practice, what's happening in the district, but they couldn't change these criteria. They could add to it. I mean, the idea that Lucy added about available staffing is pretty important. If we were at a 50% model this week, as an example, we would have had to have converted to remote. Because just the staffing impact was that dramatic. So I think that, is there any other criteria the board wants us to consider as we do this work?
It would be great to have a metric. We talk about staff availability, but Brian's question of staff vulnerability, how many can we lose before it toggles back? We don't want to start,
Sure.
when they're available, but very vulnerable.
Yeah, and we can do that, but I just want to, again, like everything else we've talked about tonight, caution you that David and Misty have managed to do miracle work where Misty should have shut down 2 weeks ago. She's figured out a way to keep the school operating. So you can create a metric, but then you have incredibly creative administrators who problem solve through that issue. And again, I commend both David and Misty for being able to do the work they've done in the last, 6 weeks. So, yes, I mean, and I think that goes to Michael's point that you can have this criteria, but you have to apply it in the real world. So the scientists have the ability to look at it as data and draw conclusions. Health professionals look at that data and say, how does this apply to how many sick adults we have, how many sick students we have, and what's our capacity to keep on going. So I think the nurses can do a really good job by this, and with the caveat, as Michael alluded to, that they're not scientists, they're health professionals.
Just the cases per 100,000 metric needs to be clarified. The state reports active cases, and they report new cases in the last 14 days, and we didn't know which one we're actually using to measure, or both. They correlate pretty well, but they're not quite the same.
All right, thank you, Michael. Anything else that you want this committee to consider so that, they can do as good a job as possible for you? All right. Well,
Okay.
Give us a shot at it, and we'll have something for you to look at on the 6th.
I did think of one thing, just to specify to Denise's and the presenters' points, are we having the same criteria or different criteria for the different ages?
Well, I think that the scientists tonight alluded to the science of 10 and below was pretty clear. 10 and above, you start seeing the same vulnerability as you see in the adult community. So I have no scientific reason to say this, but I think it's associated with puberty. Your bodies are changing and so forth, but there's no research on that. But it just seems kind of arbitrary that you go from 10 and below, and they can be asymptomatic and carry, but they don't necessarily get sick, although we've had now 2 cases of preschoolers who have gotten quite ill. So, nothing is absolute. That's the other thing about, statistics. It's this broad look at things, but the reality in your area may be quite different, going to Dan's point about how does it apply to our unique environment.
So are there other questions or concerns for Jay? I sense that there was agreement that the 5th grade should not be included in this because it's so disadvantageous to the 5th grade. Do we have to have a vote on that? Probably, right?
Well, you did have a vote to do 5 through 8, so I think you need to, have a declaration that you want the 5th grade to stay the same and that the new model applies to grade through 6 through 8.
So, I'll take a stab at a motion at that. So it'd be like, I make a motion that we, on here it says that we move forward with the new proposed middle school hybrid model that would keep the 5th grade the same, and the 6th through 8 would follow what Jay has provided for us.
Okay, is that okay?
Clear as mud.
Sorry, I'll stop apologizing as well, because it's a good question.
Can we have a second so we don't lose
I'll second
track?
it before we
Okay.
discuss.
With the thinking that you're doing with the high school and sort of creative looks at scheduling and model development, is there the possibility that what we learn from the high school could inform improvements to the middle school model?
And, it's possible. I think we can look at the high school model, and actually Jay has seen the draft, and his first reaction is, oh, this, might be something that could be helpful to me as well. So, yeah, I think so, Lucy. But we'll have to have that conversation. There are components that Suzanne has done that Jay could easily bring into his.
I think, Jay and Bill and the team have done a really good job in doing the best with the constraints that we have. But if there are ways of getting around these constraints and limiting the trade-offs that we're learning through the high school model, it makes sense to be open to what this would mean for the middle school model
Actually,
as well.
I would say, you see, that we're learning from the elementary model. The elementary models informed both the middle school and high school models. And basically what we've done is what is working in the elementary model that we could apply to grades 5 through 12. And that's really the starting point. A change in our mindset, because we often think, how does the high school inform the middle school and how does the middle school inform the elementary? But in this particular endeavor, the elementary has really led the way. And so we're actually using what we've learned from the elementary to see how we can apply it to the upper levels.
So we have a motion and a second. What's the will of the committee?
Well, I don't know. Now I'm not sure. I mean, I guess the question is, are you recommending, Dr. Morris, that we hold off till we see what the high school model is? Or
No.
are you saying we should move forward? Because I think, again, we're keeping everyone in limbo, and I think that's so difficult.
No, I didn't take UC's question to say, let's stop what we're doing and wait. I took UC's question to be, are there things that Suzanne or Misty and David are doing that can inform, and Jay can inform each other? I think it's really important that we get this model moving, and we have it, because Jay's got a lot of work to do, and I'm super hesitant to say, okay, let's stop, because we've done that before, and I go back to what Michael said and Al about, our continuously stopping and waiting for what's best next, the best of the worst, as UC talks about it. And I think Jay's done a yeoman's job in delivering what the board asked. And, let's move forward with that, because that's what the board asked.
Does this motion include how we're going to make the go, no-go decision, or is that a separate thing down there?
No, I just wanted to get the model.
To separate the fifth grade from,
I think we can't know when to do it until we actually have decided the criteria on this.
okay, so this is just separate, all this is doing is separating the fifth grade from the rest,
Yeah,
from
totally.
6,
I
7,
was trying
8.
to take the opinion of what you thought was better for the fifth grade. We might as well get that green lighted and get that moved and just get the process moving ahead.
Yeah.
So could you read your motion again?
Thankfully, you made me write it down. So the motion is to move forward with the new hybrid model for the 6th through 8th grades, and that the 5th grade will remain the same.
Okay, is that clear? Are we ready to vote on that? All those in favor, please raise your hand. 7 in favor, the student rep in favor. Okay.
I have one more question for Jay that's not related to that specifically, if it's okay.
Okay.
So
Go ahead.
It's about lunch. So we heard from Dr. Harvey tonight that the times when your mask is off is the most concerning time for transmission. So how's lunch going to work?
I thought the same thing when she said that, Michael. Bill and I were thinking about that. We currently have the cafeteria mapped out with at least 6 feet of social distancing. About 45 students can fit in the cafeteria. We've also mapped out our multi-purpose room, thinking out loud. My thought was to have students who are purchasing or receiving the school lunch would eat in the cafeteria, meaning, accessing our nutrition services, and then students who are eating lunch from home, like the typical bagged lunch, will eat in the multi-purpose room. We've also actually mapped out the gymnasium as well, though we would like to keep that as a recreational type active space for students. So we have thought of that, but when I heard Dr. Harvey's comments tonight, my first thought, Michael, was, geez, maybe Bill and I and Andrea need to revisit this with our school nurses in terms of talk this through some more. So we did have a plan, but tonight's information. And And I want to follow, I apologize, I couldn't hear your first question. I've noticed that if I'm standing out here, I can hear you much better. So I don't know if there's a problem with the mics tonight. So when you were asking about the survey stuff, so we'll make sure we get that too. So we have to talk that through some more.
Okay, great. Thank you.
One more.
One more question about staffing and staffing vulnerability, to Al's point about paraprofessionals or about budgets for this year. Would it make sense simply to proactively look to hire a few more paraprofessionals to reduce our vulnerability if staff are quarantined?
Well, we've talked about that a little bit with Dr. Morris. I mean, I do like to be frugal initially. I had 3 paraprofessionals, and that was using my resident sub person to fill one of those roles. So that's why I increased it to 4. But we can look at those numbers. We are working on this stuff in real time. As Dr. Morris said, when he asked me yesterday how many staff are impacted by COVID, yesterday it was 1. This morning it was 4. This afternoon it was 7. So it's like a real-time type thing where we're trying to, map out what are our needs. So it's a challenge.
Yeah, UC, what I would say is the same thing that David and Misty are doing. On any given day, the high school may have a bigger need than the middle school, like this week is an example. And then I would ask Jay and Suzanne to determine where the best placement of these people are in that given day in order to keep us rolling. So rather than 100% lock into a building, they're close enough, they can talk. Misty and David are talking, so we would use those assets as wisely as we possibly could to keep us operational.
Okay.
Again, we do need extra staff to pull off this model, and I'm pretty confident we'll need it for the high school as well. So that's where I think Finance Committee comes in, and I think that's what Al was asking about, being able to analyze where we are and how far we can go.
I want to try to give you some options.
Okay, we're ready. Move on to the Finance Committee report.
Well, I mean, the only thing, I'll come back, so that actually technically our charge was to work on the fiscal 21-22 budget. But I think, and I know you guys want me to give you the writing, so on the 6th, I can give you like a new charge, and then we're trying to schedule a meeting for the 7th, no pushing it. So it's like, my hope is, I think there's some areas, particularly within the fiscal 2021 budget, that we want to sit down and talk and try to figure out what our wiggle room is, more specifically, as staffing and other things come up. And so that way, when the question comes up, could we hire more, we could say, well, we have this money here. So I think that would be useful. So I'll come back on the first meeting of January and throw a charge out to you guys, and you can say, yes, I think that's good, or you can modify it, and that'll let us continue to work legit.
Okay.
Yep.
My one ask is that in the original charge, I specifically asked for minutes, so that we would be able to know, what the discussion is in those meetings, and that's kind of slipped away. And so I really want to see that. Like, I really want to see, when the Finance Committee meets, to have that documentation of the discussions that occur during those meetings.
You got one better, they're on video. So, but we
One of them, no, the November 24th.
There was only one that we did not, and it's always that, I swear. But it's like, there was one that we did not, that was just us that came in, and I take full responsibility for that. But it's like, everything else has been done in this room, and it's been videoed, and there's been minutes taken, so I apologize.
Yeah, I want to see the minutes because, quite honestly, I don't necessarily have the opportunity to see the video before the meeting in which we're having the discussion about what you discussed.
We'll do that. And again.
Okay.
That would
okay. Minutes.
We don't even like watching ourselves.
Okay. Is there more? So,
Nope, that's it.
So we need to revise the charge. Business Administrator?
So I've given you the December 11th budget update, and in terms of funds, where there are funds, you can see there are still funds in the paraprofessional account. The other place we would have funds would be in the substitute account. And then we did go through and encumber the bonds, we encumbered the leases, We made assumptions on utilities, so those balances you see are assumptions of what we think we'll spend to the end of the year. So that's where we could possibly find funds if you want to add staff. Questions?
Questions? Hearing none? Thank you. Sue?
Thank you.
So we have a draft calendar for the second review. How many reviews do we have before we vote? Is a second?
The board is comfortable, you can vote tonight. We treat it like a policy. You see it once, and it comes back to you, and it's open to a vote. Or if it's been reviewed by the teachers at this point, it's aligned with Dover the best we can, because we just have a few different days difference in our calendar. So it just awaits at this point your approval, at which point we can send it out to the parents so they can plan for the spring.
So questions or concerns about it? Hearing none, are we ready to vote on it?
Yeah. We need a motion.
Need a motion, yeah.
Motion to approve.
Moved by Brian, second by Denise. Further discussion? Ready to vote? All in favor? 7 in favor, the student rep in favor. The calendar's approved. UC has a proposal for a study group. I guess you can pass it out.
Do you mind passing? So this is a proposal to revive the concurrent teaching research committee. We heard from Erin Bobo, Karen today, a caution on concurrent teaching to think through what it really looks like. It sounds nice. And certainly we thought it sounded nice at our December 4th meeting when, as a board, we moved to reopen negotiation or to attempt to reopen negotiation with the Guild and to form a multi-stakeholder committee to look into what concurrent teaching would, what its advantages and disadvantages were by looking at other districts that were implementing it and by bringing those experiences back to Oyster River. We were not able to work with the Guild to move forward the originally moved committee. However, I think that it was the intent of the board to learn more, to see what it really looks like, warts and all, and also we're hearing from the community an eagerness to look at creative models. It doesn't make sense to have something off the table and to almost willfully remain ignorant of it. So this motion directs the administrative team to establish a working group to research other districts' experiences with concurrent teaching and to conduct a feasibility study for Oyster River, including technology platforms, instructional strategies, support for teachers and students, and possible models for voluntary implementation by individual teachers. The working group will present its findings to the board on February 3rd. The superintendent will invite the Guild to nominate members to the working group, which will also include parents, administration, and board members. So a couple points here. Number one, it's a working group, not a standing committee. This is an active group with a more precise charge. You'll see in this longer motion. To, over the month of January, really deeply look at what other districts' experiences are and to bring back best practices and how it might work for Oyster River. It makes clear, the charge makes clear, this voluntary implementation by individual teachers. This reflects my and others' perspective that it doesn't make sense to tackle the MOA and to try to implement something different across the board this year. However, even with the middle school model that we just approved, that middle school model would allow for an individual teacher that wanted to instead of having 3 classes a week, having 3 times where you touch a student, where one day is with the in-person day 1, the second day is with in-person day 2, it actually would allow them to experiment with concurrent teaching if they wanted to. So what this working group would do is to help individual teachers that are intrigued by this new form of instruction to understand what it would mean to be able to think about resourcing any individuals that would come forward. It would be fantastic to have Oyster River teachers helping to ask the right questions and helping to interpret data that we were able to receive. We also are so fortunate to have teachers as residents in our district who teach elsewhere. Some of them are actually implementing concurrent teaching now or have colleagues that are. So I think in any case we'll be able to have a teacher's mindset helping with this research and with this feasibility study.
Questions?
I think it's a good idea, because if we don't bring ideas to the table at this point, I think people are just there are certain people in this district that are going to not take that step. They want to, I think we need to, as a group, I think we need to step out of our comfort zone and start to learn some new things. And this may be, if we can show the opportunity that's out there, maybe we can change somebody's mind or maybe alter the flow a little bit to improve what we're doing. So I don't see anything wrong with it. I think if anything, it's a move in a positive direction.
Denise?
I'm just, again, concerned about the burden that we're putting on our administrators who are trying to come up with new models, do everything that they're trying to do during COVID times. I'm just concerned. I'm not, I feel like there's only so much a person can do in a day, and I feel like everyone is out straight, and that's my concern. And, I think we've got a plan to focus on implementing this middle school model. We're talking about getting the metrics to be able to determine when we reopen. We're asking our, Suzanne to come up with new high school models. I mean, I just feel like and plus, my understanding is, okay, February, and it's going to take months to order the equipment, it's the end of the year. So I'm not going to support it, I guess, is what I'm saying. I just feel like there's only so much that we can ask our individuals, administrators to do.
My only question is, do you think February 3rd is too ambitious? That's like pretty tight timeline. It's like,
it is.
I'm Scroogey, but I'm going to let you guys have the holidays. But it's like, that doesn't give you much time, particularly if you're going to try to research other districts and talk with them. So that's my only concern, is that I think that the timeline may be a little too ambitious. My only suggestion would be, once you've assembled this crew, maybe you may have to come back and say, you know what, February 3rd doesn't work. We need 6 weeks or something. I mean, again, that would be something you'd have to decide, but that's my only concern.
We can give an update maybe on February 3rd, where they're directed.
Yeah, and again, it's a working group. The expectation is that work is done in between the weekly meetings, and at least can, to Brian's point, sort of sketch out a framework for, we still want to be relevant. And yeah, no, I hear you.
Yeah.
Denise, I do share your concern, because I think ideally we've never wanted to pile on too much, whether it's committees or projects or explorations of things, but there's little about the situation we find ourselves in that's ideal. This is frankly something I wish we had done much earlier in the fall. So I think it's worth pursuing. I take Al's point about the timeline. I think just acknowledging that there might be some needed flexibility in that to make sure it's a meaningful exercise. But I don't know if this works for us. I don't know if this works for some number of our teachers, but I'm not comfortable not knowing if it would work for some of them and help to serve some of our students better. So that, I think, is the value in this.
And I think from reading the minutes of the Instructional Strategies Committee, it sounds like that group is
Not going
not going to be looking into this.
Yeah,
So,
separates the two, yeah.
right. So I don't know if there's a way to pare down the group at all to make it more efficient, but in general, I support the approach.
It would seem to me that this would work with a small group. And so, I mean, 5, 6 people.
Yep.
And I know that the guild, I mean, I know that this is like a flashpoint between teachers not just around here, but nationwide, who find that concurrent teaching, particularly the pandemic, adds a layer of complexity to a really complex teaching situation. But I was just talking to a group of teachers just a few days ago, and this topic came up. And this teacher in Portsmouth said it was like a nightmare for her. And this teacher in Timberlane, he was in his class and he showed me how he was doing it. So I think there's a variability about this. That kind of interests me. And it seems to me that too, that we don't exactly know where we're going to be in the fall either. And is this a tool that could be useful in the fall? So I don't know. I think it's worth exploring. So ready to vote?
We have a motion.
I'm in the motion.
I'll second the motion.
Yeah. So
You gotta, I think if you're gonna make it, you gotta read your slip.
I did earlier, but I'll read it
Like,
again.
I'm losing its 10, I'm like fading.
Going to have to rename it.
This motion directs the administrative team to establish a working group to research other districts' experiences with concurrent teaching and to conduct a feasibility study for Oyster River, including technology platforms, instructional strategies, support for teacher and students, and possible models for voluntary implementation by individual teachers. The working group will present its findings to the board on February 3rd. The superintendent will invite the Guild to nominate members to the working group, which will also include parents, administration, and board members.
second?
Seconded by Dan.
We don't have to fight over it, Al. It's okay.
It's like Groundhog Day.
So are we ready to vote on this?
Yep.
All those in favor, raise your hand. 6 in favor, the student rep in favor. All those opposed, 1. Motion passes.
I'd like to say also that even if the Guild does not present members to be a part of the working group, if any teachers are interested in this topic, and I don't know if this is appropriate, but to share sort of questions or suggestions through administration, it could be helpful in guiding this group. Also, it may be, I can observe that the middle school model that we've approved would allow for individual teachers to experiment with concurrent teaching, and I guess the appropriate approach then would also be to talk to administration. Is that fair to say?
Oh, sure, yeah, absolutely.
So I would just take a wild guess that you might want to be on this committee, Yuzi. How many board members did you anticipate would be? I mean, it's either 1 or 2. I mean, how many?
I'm going to go back to Michael's comment about size, and Lucy and I have had this conversation. I think it's important that this group be a small, facile group, because if it gets big, it gets cumbersome and it's hard to meet deadlines. So
what if there was just one board? I mean, do we need to have 2 board members, or?
I mean, if anyone is interested and has the time to commit to the month of January, but if not, 1 is fine.
Okay. So I mean, even though it says members.
Brian, Michael?
Did you want?
It just depends when we meet,
Okay.
one of
I'd be
your budget
interested
meetings in Farmington.
What's that?
One of your budget meetings in Farmington.
Well, it's almost every day now.
Well, then that's what we're meeting, Brian.
Well, board meetings Monday, budget meetings are once a month, but we'll work it in.
So would you be interested in being on it?
Unless Michael.
Okay, if I nominate, because I need to nominate members, and since, I assume you want to get moving on it, yeah?
This is not a board committee, though, right? This is an administrative committee.
Okay, so you pick?
Yes, I can do that. I pick UC and I pick Brian as if he's
Okay.
available.
Okay, good choices.
Wow.
I would have picked Megan, but she looks like she's going to go to sleep any minute.
Megan, you are a real trooper, boy.
Better than I am.
I think that's all our business.
What about the coaches?
Oh, coaches, no.
This time we do it.
Could I have a motion? A motion to approve the coaches.
Motion
Brian?
to approve the coaches.
Moved by Brian. Is there a second? Second by Denise. Discussion on this? Hearing none. All in favor, please raise your hand. 5 in favor. I'm sorry.
Sorry, did you want us to raise our hand
Yeah,
again?
I'm sorry.
In
5,
favor?
yeah, 5 in favor, the student rep in favor, all opposed, abstentions, 2 abstentions. So those coaches are approved. School board committee updates?
Do we need to vote on the remote posture for the next 2 weeks? Or
It depends on what you want to do, Michael. I mean, it can be done by administration without a vote, or it can, if you feel more comfortable validating my recommendation, I'm okay with that.
I'm okay without a vote. I thought you had asked for one earlier, so.
I would ask for the board's support, obviously, because I'm going to get beat up tomorrow.
So what, I'm sorry, what?
Michael's asking whether whether I would like board support on the decision to go to remote learning starting on Monday and through coming back on January 11th.
So long as that doesn't establish precedent or expectation that we will vote on every in and out.
No, I mean, it's totally up to you. I mean, I think it's within my prerogative, but I always my preference would be not to be out there by myself, you know? So if the board is comfortable validating that, I am more than comfortable to have you vote on it.
I think the DOE is, I know in conversations I've had with them, they prefer a vote from the board to give you the authority. So
Does that need a motion then?
It would.
Okay. So,
I'll make that motion and make sure I say it right. That I make a motion that we go to fully remote as of, what is Monday, the 21st? Monday, December 21st through, and it's Friday, January 8th, correct? Okay.
Yeah.
okay. So moved by Denise, is there a second? Second by Brian. Ready to vote on that?
Can I just clarify something? I think my understanding of what we're doing is if we vote for this, we are supporting the superintendent's recommendation, but he has always been empowered with the authority to make these decisions on the fly.
That's how I would see it as well, Dan.
Okay, with that understanding, ready to vote? All in favor, please raise your hand. 7 in favor, the student rep in favor.
Thank you.
Board committee updates? Hearing none. Public comment?
Hi, my name is Darren Scopel. I have a junior. My daughter's a junior here, and I'm a teacher at Spalding High School. I think there's a theme here, so at least a third person. And of course, I had written out some notes on my phone, but my battery died, so bear with me. So, you know, I sympathize with the conversation. I've been watching for several weeks now, and, you know, I sympathize with your position because, you know, as you know, we went full in at the beginning, and certainly at the beginning, I had a lot of reservations, right? Is it going to be safe? Are we going to be able to maintain distance? We went with 3 feet, as you know, and you know, once we started school, within a week, I realized that this is not an unsafe situation. That, you know, all the kids were wearing masks. We were cleaning in between classes. We bought dividers to separate whenever we couldn't maintain a safe distance. We used dividers in the lunchroom to help compensate for spacing issues, and I realized that the kids really aren't going to transmit it in school. It was going to be once they left school and went onto the soccer field or went into their car and went somewhere. As far as, concurrent learning goes, at the beginning, we were going to go 100% in person or do VLAX. And then all of a sudden, a week before school, we found out we were also going to do remote, Spalding remote. And at first, I was not happy. This was not what we, agreed to, and I didn't think it was a tenable thing. I had many of the concerns that I think teachers in this district share. But once we started doing it, and I realized that, look, I need to at least give this a try, it really was not that big of a deal. And, it was as simple as me opening my laptop, logging into my Google Classroom, and then all of a sudden, there are my 6 remote students, along with my 15 in-person students. They were listening to me lecture, they were asking questions. I supplemented with a microphone sometimes to compensate for audio. If we did a lab, I'm a science teacher, if we did a lab, I had them collecting data remotely as students did the physics experiment. So it was way more effective and easier than I anticipated. And at the beginning, I was not on board with this at all right? And I think a lot of my colleagues, including Mr. Disco, who spoke at the beginning, would agree. I helped him set up a laptop on an old UV audio visual cart. And so he's a photography teacher, and he just moves that cart around, and it's very interactive. So did we plan for those things? No, but we, the staff at Spalding as a whole is great. And I think, I've seen inside a lot of classrooms here, and there are a lot of excellent teachers here as well. And I think once things start going, you come up with ways to make it work, and students were coming up with ways to make it work. So I wouldn't, I'm glad that there's going to be a committee to investigate that more, to, hopefully alleviate some concerns as far as that being a tenable thing. I think the guidelines that Dr. Harvey has shown you, I haven't seen them, but I also know that their CDC has guidelines on their webpage now. They came up with a table that didn't used to be there, but I saw it the other day. But as far as figuring out which rate to go with, I would suggest looking back to October, or when a lot of our schools were in session and those rates were low, and the transmission rate within the schools was not happening really. I mean, between students and staff, I'd say there are about 5,000 individuals in the Rochester School District. And when we went remote a few weeks ago, we had about 10 cases up until that time. So the transmission rate, and that was including rates that came in from out of school and not necessarily in school. So that's pretty, it's 0.02%. It's pretty low. So that might be a good guideline. I can't remember what those numbers were per 100,000, but that might be a place to start. I'm glad to see you guys are looking at that happening. And the last thing I'd say, because we were in 100% and students were remote, I would, if you establish that guideline, I would look at a point where you would say, all right, students will come back 100%, and some students will stay remote. And if you develop a way or come to terms with concurrent learning, that makes that a doable thing. We were doing it, and I see now that it was a effective way to conduct the school. It was way better than what I'm doing now. And, what I'm doing now is, some days are better and some days are worse. I think every teacher across the country can sympathize with that situation, but I think that's it. I wish we could have a discussion, but not in this environment, but another time.
Yeah.
Thank you.
Yeah. Have a great holiday.
You too.
I think that concludes our business. Could I have a motion to adjourn? Moved by Brian, second by Michael. All those in favor, raise your hand. 7 in favor, the student rep in favor. Happy holiday, everybody.
Happy holiday.